Namaste. Good morning to all. Welcome in the today's session, the day two of 42nd Annual National Conference. Today we are going to start our first academic session, although that we had finished our one free paper session yet. But on this main platform, we are going to start with award paper presentation that is for doctoral and pre-doctoral category. And for the sessions, we have two chairpersons. One is my senior and beloved one, Dr. Naren Kumar Singh from Central Institute of Psychiatry, Ranchi. And second, good friend of mine, Dr. Sandeep Jagdale from Solapur. So, sir, the session is handed over to both of you for further proceedings. Thank you.
Thank you, Dr. Bhupender, for your nice introduction. Good morning, everyone. Welcome to the second day of 42 Annual National Conference of Ispsw. Today's session will start with Ispsw Award for MPhil and PhD Scholar. In this category, we have received 3 papers. So I hope they will be joining soon. For the presenter here, I would like to give some instruction for the presentation. Each presenter will have a total 20 minutes with 15 minutes allocated for their presentation and 5 minutes for discussion, clarification, question answer, and other things. So I kindly request to all the presenters, please adhere these issues and finish their presentation within time. And after that, we each the presenter we have 5 to 10 minutes for the question answer. So as soon as each the presenter finish, we have take a question answer from the audience. Then we'll go for next presentation. With this instruction here. I would hand it over to my co-chairperson for further proceedings. Sandeep sir, over to you.
Thank you, sir. Thank you very much. I request the first presenter, whoever is present, I think Miss Joy. Joy can start your presentation.
Okay, sir. Sir, shall I go for screen sharing now?
Yeah. Yes.
Yes.
Is my screen visible now?
Not yet.
Your screen is visible, but not your PPTs. So select appropriate option.
Now is it visible, sir?
No, screen is visible, but PPT is not visible.
Do it for sharing your PPT. First, you have to open your PPT.
Yes, sir.
Then go to the share section. From the share, you have to select an option, share a window. Then you have to choose that window where your PPT is open. Then it will be visible for us.
Okay, just a minute, sir. I'm trying. So where is the shared option? Can you just guide me once in the PPT? Because I have opened my PPT and tried to share it.
Choose the option share. Click on it. You will find option screen. select the appropriate screen where your PPT is open. Click on your PPT screen and then share. Understand?
Yes, sir. I'm trying, sir.
First, open your PPT
Yes, sir.
in your desktop, laptop, whenever it is,
Yes, sir.
and then come back to Zoom. Select the option share. After share, you have to choose the option screen. And in screen, you have to find your PPTs, open PPTs.
Okay, okay.
Click on that PPT, then share. Then it will be visible to us.
Now is it visible?
Yes. Yes.
Yes. Yes.
Go for full screen.
Yes. Now, sir? Is it okay?
Go for full screen.
Yes, sir.
There is in right side in there is symbol for full screen. In cup design. You have to click, then it will become a full screen. Yes.
Sorry for the inconvenience, sir. A very warm good morning to the session coordinator and one and all present here in this session. My name is Joy Datta Chaudhary. I am a research scholar in Department of Social Work, Assam University, Silchar. I am pursuing my PhD in the field of social work with older persons. Today, I am here to present my paper titled as Feminization of Aging and Associated Vulnerabilities in India under the award category of Gender Issues and Empowerment of Women. I think this session will be a great platform for me to share my findings regarding the older persons' vulnerabilities in India, and my suggestions to empower the older women will be helpful for the researchers working and the practitioners involved in geriatric care in India. I'll begin with the introduction. An increasing percentage of the older persons in the country is increasing as the life expectancy increases and the birth rate decreases. India is about to reach a turning point where, in its history, where the older person will increase and putting an immense burden on the working population. So this growing population has it will be thing for the discrimination and vulnerability. So the factors lead to vulnerability includes for older women, social events, individual situations, disparities brought about by social, economic, and cultural structures. This distribution of resources that is uneven, making the underprivileged more vulnerable. In this center of every thing, women who are often outlived men will be more discriminated or more vulnerable. So, because women have less savings, they were unemployed in the beginning and experiences health problems. They find a simple course more difficult and also know about the government schemes. They also know very less about it. Since 1961, there has been a rising trend in the proportion of older people in India's overall population. 5.6% of the people of the total population.
Sorry, Joy, your slide is not visible.
Sir, isn't it moving?
It's only first slide.
It's not moving.
It's not moving. I think your
It is
network
not
is not good
moving.
or something. You just stop sharing and start sharing again.
Okay,
Once
sir.
stop it and restart sharing.
Okay, sir. Sure. Now, is it visible, sir? Now,
It's visible, but first slide only.
Now it's moving or
No, it's not moving. You just click this side.
So I'm doing that. I'm
But
changing the
still, it's
slide.
not moving. Yeah, it's not moving.
So is there any provision that you can share it from your end?
Did you share it with us?
Yes, yes. I have shared it with Bhupendra sir.
In mail?
Yes, sir, on mail.
Okay, just give me a minute.
So is it moving now?
Joy, I'm presenting on your behalf.
Sir, I'm stopping the presentation.
So you just tell me when I have to go for the next.
Yeah. Sure, sir.
Rest
Yes,
I
sir.
will do.
Yes. Next, sir. Forward, sir.
Should I take back?
Yes, yes. Yes, sir. Actually, I have discussed the first, this page I have discussed already. Yes, sir, this one. Shall I continue?
Yes, please.
Yes, yes, please.
So since 1961, there has been a rising trend in the proportion of older people in India's overall population. It was 5.6%. So one slide before.
Back.
Yes, sir. Yeah.
Yes.
Since it was 5.6% of the people in the total population were about 60 in 1961, and in 2021 that number had risen to 10.1%. By 2031, it is projected to reach by 13.1%. The older population sex ratio also grew from. So the half slide is visible because yeah, now it's fine, sir. Thank you. The total older person sex ratio grew from 938 women and 1,000 men in 1971, which is in 2011 it grew to 1,033, and it is expected to reach by 1,060 by 2026. The India's older population appears becoming more female, which is widening the gender disparity in longevity. So next slide, please. Yeah. The vulnerability is defined as a state in which the individual is more sensitive to negative consequences, particularly those affects the quality of life. This condition of vulnerability is linked to person's situation and setting both individually and collectively. Aging is a multifaceted and multi-determined phenomena where individual, social, and environmental factors favor sickness and difficulty in accessing protection and provided in the society, important in addressing vulnerability among older women. The next slide, please, sir. Here is my methodology. The objective of my paper is to find out the various kinds of vulnerabilities associated in feminized aging. And the second one is to suggest effective measures to reduce vulnerability and empowerment of older women. And this is considering these objectives, my paper is a descriptive research design I have involved. And for sources of data, this secondary data collection I have done from research articles, conference papers, and government reports or journals, etc. Next page, please. This is a discussion part. The vulnerabilities associated with older women in India, I have segregated into sub-themes. First one is the social vulnerability. Due to varying trends in lifestyle and family structure, which was before it was a joint family structure, and now we have shifted to like nuclear families where older women, they often suffer from social isolation, and the older women has challenged both privately and publicly with little power, low status, and few resources. Older women, particularly those living alone, may experience isolation due to widowhood, migration of children for work, changing in family structure, which I have already discussed. In India, India faces a notable educational and literacy gap when compared to their male peers or younger women or men. So, barring exceptions, women have never been independent and socially, financially, or physically and psychologically. Moreover, most women are unaware of their rights, and so due to their less social interaction. Some of the common social vulnerabilities includes social isolation, loneliness, ageism, intergenerational gap, and like all these things are contributing to the vulnerabilities socially for older women in India. So the next slide, please. Next comes the financial insecurity. Here I have mentioned the old age dependency ratio that was 10.9% in India in 1961, which was in 2011 it has risen to 14.2%, and it was projected to rise by 15.7% in 2021, which is also likewise in 2031 it is expected to grow up to 20.1%. The female old age ratio depends on the male significantly higher in Kerala, Tamil Nadu, Himachal Pradesh, Punjab. In the projected year, it was projected for 2021. And older women who are totally dependent on others was higher in Delhi, Meghalaya, Punjab, West Bengal, and it was lowest in Manipur, Nagaland, according to the state data of economics independence. Next comes the conversely, in urban region, the percentage of women who are completely reliant on older others was lowest in Arunachal Pradesh, that was 16%, and it was greatest in Jammu and Kashmir, that was 85%, and it was again lowest in Sikkim and Telangana. Next, in India's patriarchal inheritance system, that the property inheritance was for the male lineage. It was historically preventing women from owning property, which was also a reason for financial insecurity of older women in India. They receive a very less amount of pension. If we talk about the oldest pension scheme, so it is in my state it is like 2,000 rupees for every person. So, sir, 2,000 rupees, it is very less. They cannot afford their medicines also, and they also have to depend on others just because of this. So, it would be better if we can just consider this as a financial insecurity for older persons. So, I have also mentioned here some of the social insecurities like healthcare expenses, financial exploitation also happens for older women in India. So, next slide, please. Next comes the health issues. Older women experiences health issues more than their male counterparts, but they don't go for doctors, or their health seeking behavior is less according to in comparison to their male counterparts. They become progressively less able to carry out their regular functions. They're unable to do the works previous years, and the majority of the nation. It is also proven that the majority of the nation's medical care users are older persons. Women, because of their less immune system or weakened immune system, they also find themselves more vulnerable to diseases, which is a great reason for their health issues. So here I have mentioned few of the vulnerabilities, like few of the issues that can face, like low vision, hearing impairment, joint pain, diabetes, low or high blood sugar, respiratory problems, lung diseases, etc. So next, gender-based abuse. When someone hits, pushes, or slaps someone else, it is considered as abuse. Most victims of abuse are women or older women without close relatives, friends, as well as those who are suffering from any type of impairment, memory loss or memory issues, where dementia, etc., are likely the targets. So abuse can happen at any place, starting from home and assisted living facilities, nursing home, relatives' homes, or family members, by strangers or like medical professionals, caretakers. They can go for such abuse, older women. So here I have also mentioned some abuse like emotional abuse, neglect, abandonment, financial abuse, sexual abuses can happen with the older women in India. So the next slide, please. This is, I have mentioned here psychological dysfunctions. Loneliness because of the unavailability of family members. They suffer from various types of problems which comes from loneliness. This also creates a great impact on their quality of life. They suffer from behavioral changes due to cognitive deterioration, which is also a reason for their low health status or low quality of life. According to World Health Organization 2017 report, 20% of the persons above 60 years of age, they are diagnosed with mental or neurological disorders. Being these things are unidentified among the older women because of the stigma associated in Indian society, and they also don't go for asking assistance for such psychological dysfunctions. Some common psychological vulnerabilities I have mentioned here, like depression, anxiety disorder, cognitive disorder, sleep disorder, etc. So next slide, please. Here I have mentioned caregiving burden. We know that family is the most important asset for us, who provides us with all type of assistance we require. But due to the breakdown in joint family system, women in India, they are also suffering from loneliness. They are likely to mistreatment and neglect due to the generational divide. Due to the generation, these days generational gap is widening. People, older women are left alone at home because both the partners, the younger generation, both the partners, they have to go for work in various sectors. So they cannot give proper time, or they cannot provide everything for the older women, which is also a reason for their exploitation, which is also a reason for their vulnerabilities in India. So before it was like all the family members staying together, and they can just manage their time to look after the older persons. But these days, this has been a problem for both the generations, for the older generation as well as for the younger generations. And due to this, their health is also deteriorating. Their low quality of life and social isolation is also increasing. So there has to be a cooperation between both the younger generation and the older generation to deal with this caregiving burden. The next slide, please. Now, after mentioning all these vulnerabilities, I would like to share some of the suggestive measures I personally think, and I also have gone through the various literatures where I have found that this could be probable solutions for the vulnerabilities for older persons, older women in India. So India needs to create policies and programs that support gender parity. Expanding contact centers by mobile health services can explicitly address the requirements of older women. Particular consideration has to be given to widows in India, because as their number of widows are increasing, we need to think particularly for them with explicit policies and programs. The aware older generations, older women, we can aware them for risk factors and the rights meant for them. The government should expand, make sure that the initiatives and support widows financially. Financial stability has to be administered properly. Like I have mentioned that rupees 2,000 is not sufficient for older women to make all their expenses and also for going for their everyday fooding. So this could be again considered by the government, that it is financial, their stability should be maintained. And the 2007 Maintenance of Welfare and Welfare of Parents and Senior Citizens Act should be enacted in its entirety. So the next slide. Multidimensional strategy involving active collaboration across the social welfare department, health department, rural and urban development department is required. And Indian policies should encourage women workforce to engage in more and more in jobs, so that they can be more independent financially, and reduces this burden when they are retired or dependency on others becomes prominent. See, the India must update its retirement and pension laws, which I have already mentioned, in order to provide old age pensions, health insurance, and appropriate sources like Panchayati Raj institutions should be involved more. And it is necessary to promote cooperation between government organizations and NGOs for the empowerment of older women in India. The creation of a comprehensive strategy that addresses not just medical issues, but also the other determinants which I have mentioned, like through a community-based geriatric healthcare program. Next, sir. In order to strengthen the family bond, younger family members also should take out some time to spend with their mothers or grandmothers for their enhanced living. And it is necessary for our part also to raise awareness, to make the geriatric population aware of their government schemes, which are meant for them, which are like reservation, like in tickets also there is reservation policy where above 60 years they could get some debate for themselves. And so it would be better if we could manage from younger generations also, if we could manage this raise awareness regarding their policies. So, and also we should get ourselves also well acquainted with the policies, and so that we can manage them well. To assist older women staying in connected, NGOs can conduct courses like for computers or smartphone use or internet, because many of the older women, they are not acquainted with how to use smartphones, how to use a computer, just a bare minimum, how to use a WhatsApp, how to video call, how to do these things will make them more able to how to use YouTube. This will also help them to deal with social isolation, so that they could spend their time, which is they are spending on loneliness. They can spend their time with something productive or useful for them. So provide volunteer opportunities also can be a good option for older women, because they are also acquainted with knowledge which they have taken over from their whole life. So if we can just take their knowledge, how they have managed their life, how this can be useful in today's world. So I think this will be also a great option for them. And NGOs can create facilities like interaction areas. They can provide leisure, education. This could be done in locally, like in a place, in a community. They can share their interest, they share their ideas, what they have done whole day. These things will make their life happier or a bit easier. Next slide, please, sir. Government and NGOs.
Please finish within 1 minute. We are going
Sure,
shortage
sir.
of time.
Okay, sir. Can we move to the? This is like we can. I can complete in just few time. The international bonding is also required, sir, due to this widening gap. We are facing more problems. The older women are facing more problems. My generation, like I am, younger generation is also facing some problem. So we have to mitigate that time. So we need to spend more time with them. Afterwards, it will. Otherwise, it will create more gap. So next slide, please. Yeah. To conclude, I would say that the government of India is obligated to provide social security as stated in Article 41 and 46 of Indian Constitution. It is for the well-being of the persons. We need to prioritize preserving social support network and traditional social institutions that are already in place, like family and kinship, to deal with these vulnerabilities associated with feminized aging. The government and non-government organizations can play a pivotal role, which I already have suggested in this paper. So, sir, I think there is no meaning of adding years to life. Rather, it is important to add life to years of older women who have spent their entire life for the families and communities they live in. And every woman deserves an empowered later life despite of all their vulnerabilities I have mentioned in this paper. Sir, next slide, please. These are the references I have gone through for these. Next page also there is references. So next, thank you, sir. This is the end of my presentation. Now I would like to have some questions, if any.
Thank you, Juhi, for your nice presentation. You have finished within the time. So this is very important topic for the current scenario when you are working with the older women.
Yes, sir.
And you have given the very in-depth data related to various aspects of the older women, and also suggestion what we can do if individual is having these types of issues,
Yes.
especially in women population. With
Yes.
this word, the topic is open for any clarification, question, answer, any contribution, any clarification from the participant. Please, we have 2 and 3 minutes. So you can ask any question, any clarification from her. You can raise your hand, then our moderator will promote as a panelist. You can ask the direct question, otherwise you can also write a question answer. We'll ask on the behalf of you. So anyone, any question, any clarification, free to ask.
Ravi sir has raised his hand and I promoted him. So Ravi sir, you can directly ask us.
Yes. I joined late. May I know the name of the presenter?
Dewey.
Jui.
Sir,
Juhi.
my name is Jui Datta.
Okay. So, Juhi, I would like to know that as you presented that vulnerability ratio in rural areas across the country is different for different states.
Yes, sir.
The Manipur state had the lowest, almost lowest vulnerability ratio. So, have you analyzed for the factors that are contributing to the vulnerability ratio?
First of all, thank you for the question, sir. Sir, this data is according to NSO 2021. I have not gone through like for the data, particularly any studies from like Manipur, how it is they are contributing to low like that. So I just gone through this report from NSO where I have found this data. Sir,
Okay, so NSO majorly depends on the economic issues, financial, the socio-economic condition, majorly economic
yes, sir. Yes, sir.
basis
Majorly.
that consider.
Yes, sir.
So
Economic.
just I would like to share with all the participants that in Manipur you have a matriarchal family system.
Yes, sir.
Where the women are expected to lead the family, and even they are the major breadwinners. It is culturally, it's there for generations. Like in other parts of the country, you will find patriarchal family systems. In Manipur, it is different. So these kind of, if you have suggested so many measures, so if these kind of cultural practices can be copied to the other parts of the country or can be promoted, then apart from other measures, I think that it can also contribute to lower the vulnerability issues of older women in other parts of country. So it is majorly the what I want to focus is if the woman gets a chance to lead, which we are having nowadays, not nowadays, for so many years, like promoting girl child, promoting education and all the things. So it is going to contribute at later age. I mean, it will take a generation to reach there. It's whatever measures you have suggested is applicable for those who are somewhere affected by all these issues.
Yes, sir.
Ji.
Sir, I would like to mention that I didn't know, I'm also from Northeast, but I was not aware that Manipur is also a matriarchal society. As far as my knowledge, it is Meghalaya, sir. It is a matriarchal society followed in Meghalaya, sir. So again, I'll go for studying this Manipur society so that I think it will enlighten me. Thank you for your suggestion, sir. As I have mentioned it, like patriarchal society, there was no provision for inheritance of this property for women in earlier days. Which was a reason for today's older women are facing such problems. This is a very good suggestion, I think, from your end also, sir, that matriarchal societies can find it more easier to deal with such problems, which I have, and the measures which I have suggested, these will also create a great impact on matriarchal society, sir. Yeah, thank you for your questions, sir, and your suggestions. I will definitely go for studying such things for Manipur also.
Thank you. Sandeep sir, would you like to say
I
something?
want to just suggest that at the PhD level, student or scholar could go for some exploration.
Nice.
So beyond the desktop research, I suggest her to go for some exploration.
Okay. Thank you, sir.
Yeah.
If there is no further question, then we can move for next presentation. Next presentation will be presented by
Putta Mare Govda. Let him introduce himself.
Yes, Putta Mare Gotta. He will
Shall I
be.
mute myself?
Yeah, you can. He will be presenting the topic group work intervention for family caregivers of elderly person with mental health problem. So, Putto Mare Goda, over to you.
Thank you, sir. Good morning, one and all. Sir, shall I start my slides? Is it?
Yes.
Okay, sir. So I'll go for slideshow. And thanks for the conference and opportunity to present my paper here. As I go here, I myself, Putmare Goda, I am a PhD scholar. I am working in Geriatric Clinic and Service Center unit as a senior research fellow. And this is my topic, group work intervention for elderly person with mental health problem. As part of my PhD topic, I try to look into that in my clinical setting, how this group work will work. So based on the clinical experience, this is like a trial and version we are done. And this is under National Institute of Mental Health. The geriatric clinic is a part of a unit where we are working in OPD as well as IP-based elderly care, where we try to look into that how this group work model can be utilized for the psychosocial intervention and manage the elderly and their family members' mental health related issues. And along with me, my guide and my colleague and other PhD MPhil scholars and other black placement student and psychiatry team is involved to do this intervention package. As I look into the themes and sub themes, these are 3 themes looks into my topic. family in that area there is elderly, and also it look into a health and mental health perspective, and also we are looking into in a sustainable development goal and healthy aging perspective how this can be a strength perspective approach. So this is my order of presentation. Coming to introduction, we know that elderly is not just about a number of years looking into a chronological aging. It is also looked at as a later part of one's life, and it's looking that an elderly person is not just a one person who's reached to the number called 60 and above. It is called as an older person. Is the elderly person is reaching an higher rank in oneself in a human life development stages, and also it's an influential member in a tribe or in a community. The elderly person, and put it in a number as per the definition of United Nations organization or the policy, or this is because to provide the welfare or meet their needs. It's under the legislative related only. We always look into a chronological order. Otherwise, elderly has other aspects called physiological, psychological, social, economical. All these areas are looked into elderly and their aspects. And also, we know that there are various aspects or issues related to elderly in all this area. It's not just their elderly, their age-related issues, hospitalization, not just a physiological or chronological related issues. There are a lot of other issues, ecological, psychological. In that perspective, we looked at these issues. Why can't we address it in psychosocial manner, not only just in a medical issues when the patients come to the OP or IP? So how we can look into their psychological and emotional and other aspects of the mental health. So this is how, if you look into in literature, geriatric demography is a growing population, 60 and above, not only in globe, including in India. Even census 2011 also suggests that population of elderly is growing. So it is going to be 8.6% of our population in the 2011 census. And in the globe also, it's going to be double as the United Nations predicts. So that is why geriatric mental health becomes an area where we have to focus on not only the elderly and their mental health aspects, and also looking into their family members, those who provide care. So here, physiological as well as psychological, they're looking into their culture and the areas where look into that social aspects. All this makes a sense when we are looking into mental health of the elderly and their family, especially loneliness, disability issues, and how the family structure is changing, how support system is changing, what are the social security measures available in our areas, and how they resiliently look into the issues and how they support each other. All those areas look into that like a psychosocial areas where the psychosocial intervention make the differences. So based on that, we move into that. Why can't we look into a strength-based approach by using a group work method as part of the social work to help the elderly and their family caregivers? So we know that group is more than 2% looking into achieving a some particular objectives, and it's been well defined in our social work profession. What is social group, especially Hamilton and all, they clearly told how social work can be achieved as a method, and what is the role of the group worker as a facilitator, and utilizing the group resource and members, how we can help as a peer supports. And group work, we know that it has its own purpose, and the group may be vary depend upon the need of the group member and the participants. And there are different way of to achieve the group work goals through the various models has been adapted, uh, depend upon the members and the area we are targeting. And in this area, we looked at this family based intervention, utilizing the group method as a social work and also a strength perspective. We thought that this package will help them out. So we look this scope as it is. Family caregiver comes to with a various experience when they're dealing with elderly and with their various mental health problem. For example, elderly person comes in the depression or schizophrenia or dementia. It's not only affecting the person with the suffering and also the family members. They look into a lot of caregiver burden, and sometimes they don't know what is the illness related information, how to get the support. Sometimes because of their poor KP delay in the treatment, all this makes that social intervention is the need of the hour, and that's the thing. Not only targeting the elderly person and also with their caregiver, it is mutually help the both the population, and it's been replicated in United Nations Organization Sustainable Development Goal also. In that thing only, the UNO came with a concept called the elderly related areas. earlier this called as a active aging, then it came as a concept called healthy aging. They declared 2021 to 30 as a healthy aging decade also. Try to utilize all the sustainable development goal inclusively to target the elderly person and their family, how we can achieve a sustainable healthy aging in that area. So group work also, if you look in that objective and goals all this way, it also target the support system where we can help the person with all the difficulty and their vulnerability, whatever it comes. So in that way, family is the one of the strength we adapted, and we thought when the family is helped, automatically the elderly person also being helped through the system. And so this is why we kept a aim to understand what are these multifactorial aspects of psychosocial intervention can be provided to elderly and their family members. So we kept the two objective to reach these. One is to design the group work package, and second one to look into that how it will be feasible to do with them. And uh, these are the inclusion and exclusion criteria we kept while conducting. Sorry. It was based on the compatibility of the elderly and their caregivers, the languages they know, and we had a MPhils we used as a therapist during the OP and when they get admitted. And we also looked at when the group work is going on, some of the difficulties arise and their needs are quite away from the group. We tried to have some individual session also to look into that things. And the group work process was planned and it was a clear SOP is being established, and whatever we conducted the group work and outcomes, how these challenges are all we are noted in a Excel sheet in each session followed by the sessions. So it's OPD and IP little vary the way we conduct the group. That will I explain in the result part. Then the universe of the study, as whoever comes to an OPD and those who got admitted in a IP, we conducted this group. And sample was adapted purposefully, and it was a convenient sampling method. And it was to ensure that all the group members are involved to achieve the psychosocial consultation and address the psychosocial issues related to elderly and caregivers through the group work principle and clear SOP we have made it. And these are the themes we came out through the review of literature, and also when we had done the pilot group work before conducting an actual group, we conducted a 3 months period of pilot group work. Then we came to know these are some of the areas we can look into that addressing as a elderly and their family related issues. I will show it in result further again as it what are some of the main themes we added here. We had conducted OP and IP parallelly. IP we conducted once in a week or twice in a week, but group work were conducted once in 3 days in a week. So this when we are conducting OPD basis, these are some of the themes based on the pilot visit study and based on the review of literature we targeted. And this is we looked it in the group session also. So their mental health awareness related, how this culturally they're adapting, how much their KAP is good enough, how much they're looking for support, how what are the models and pathway they're coming to the treatment. All those we majorly targeted in OP basis. In looking into IP, because it's a more settled group, and there will be like staying in for a week or 2 week in a ward side. So we are able to have a 1 weekly session. So we conducted more structural intervention or therapeutic based intervention, where OPD was more like a supportive based group work. So here we targeted not only just looking into the basic level, we also looked into their integrated, how these facilities available, how they're accessing the support system, what are the welfare things related, and what are the caregiver level support they're availing, and how much they're able to look into that, and how they can able to achieve it. Those are areas we try to target in the IP basis. So based on the both OP IP intervention, what we come to know that this group work intervention is a feasible, but little difficulties looking into the challenges, especially working with elderly with the different issues. And also we done these sessions for a 1.5 year from January to June 2023. But in the earlier phase, as I told, 3 months this was a pilot things we done. So where we conducted in IP as a 10-bedded ward, where from 11 we started in the November to get into pilot study done. Then Jan onwards we started actual 1.5 year intervention things, and we recorded in the Google sheet whatever we conducted, who are the therapists involved, how these therapy sessions went on, what are the challenges process we had done. And this is the glimpse of IP group we conducted. It's around 84 groups we conducted during the 1.5 year. It is basically 30 to 45 minutes of sessions, and participants usually minimum 3 to maximum 10 members were there, and the therapists were involved. Minimum 1 person and maximum 4 person was involved. 213 in that sessions been therapists been involved in total. And this type of groups usually we try to conduct with the patients group alone. We felt very difficult. Then we went on more like a mixed group, are having a separate caregivers group. It was 54 and mixed group around 28. Total 84 groups we conducted in IP. Similar way, we in the OPD basis also we started the after the pilot study 1.5 year it is there, and it's 15 to 30 minutes of sessions, and we recorded all the themes what we had done, and challenges we faced, and whatever intervention was useful for them. And around 141 group were we able to conduct. And as I told, it's a 15 to 30 minutes of sessions, and 3 to 25 members, because it's an OPD group. The population is very large. Sometimes there will be, because of the ongoing sessions, very less people were there, and sometimes it was a huge group. That's why very difficulty to conduct a OPD, even though it's a support kind of group. Difficulty to balance those populations compared to IP care. So there are therapists also similar, 1 to 4 therapists were there, and we couldn't able to have a separate patients group over in the OPD because the always is hang on to the caregivers. So that is the reason we always add a mixed group or caregiver groups with the OPD basis. And based on the IP group and OPD group, these are the things we are able to come to know that elderly person with mental health problem and their family caregivers were provided group sessions for a psychosocial support, ranging from psychoeducation to support work, where we started, and it is looked into home care strategies, how to do home-based interventions, and what are the follow-up need for the elderly and their family members, what are the welfare-related issues and security-related things we covered, and alternative care options. Not only a primary caregiver who is the elder responsible to look into that elderly and their issues, and they should look into take care. There are formal home care facilities, assisted living, and there are a lot of institutional care. It's not just option for the home-based care or a family-based. It's also an alternative options where there is a required when the elderly person with the acute need, especially palliative care and hospice care, all those we looked into that, and unique case-based queries there, especially the elderly with banking related issues, guardianship issues, all those issues came in out. But at the same time, we know that this group has its own limitations to cover so many areas. We had a time-bound interventions. So along with that, we had, as I said, individual related issues. Because of these are the issues we identified during the group work. Even though it is a feasibility test, it's not easy to as we expected. So there was accountability issues, cultural disparities when we are conducting an OPD basis group, and it's a difficulty to maintain a confidentiality where they comes to open areas where to conduct group. The areas is also limited, and no, there is no space, and how to communicate, because there are many people comes with the different languages, and our therapists also have no only 1 or 2 languages. It's very difficult to manage, and reflecting their progress from one OPD to another OPD is also very difficult, because they may forget or they may know idea what we done in the previous sessions. So managing the time, especially in the OPD, because the other things are going on parallelly doing all these issues we faced, and one group wouldn't able to reach all their needs. And even though in similarly in IP based also we've seen that the balancing the individual needs, there are different individuals, they have their own unique issues. So addressing all those issues very difficult, because their background and all we have to look into that. There are a lot of personality related issues that we not covered in our group, and there are group dynamics. Even though we put it group work as a method, we felt very difficult when we are conducting in, especially elderly with dementia, elderly with a lot of comorbidity issues, and communicating their needs, felt needs. Even though we try to adapt the remittance therapy, it was not as easy as we expected to do, because one group varies from another group. There are people are moving, floating population was there. So, and also we couldn't able to find a homogeneous kind of group while conducting the IP based group. So based on that, we come to know that the study is helping to a researcher and academician to get a knowledge about how we can do a psychosocial intervention in a group format, especially in India as a low middle country, low income country. So it highlights that the multidisciplinary team not only look into just medical consultation, We also look into a holistic care where there is a group work method can adapted and psychosocial intervention can be provided to elderly and their family members. And it also try to review that whatever we try to do in this area, it's getting an attention that our elderly not just coming with a mental health problem, and is easy to understand on an individual level. It's also can attempt on in a group level where we can help them to learn mutually, and it is a more costless, and we can make it effectively if it is getting the support already is existed. So it also provides that an insight and initiative to discussion over psychosocial intervention as part of our regular clinical services setting, where we no need to too much staff required, and we no need to think about resources are required. Wherever actually existing system we can utilize, and we can provide these group of interventions. To conclude, the thing is that the psychosocial needs of the person with mental health problem and their families are varied, cannot be addressed one type of intervention package what we have developed. Maybe we have to look into that more holistic and more as a like a blended approach, like family, individual, and group work based. Like that will be more enough. We felt it. So in that, but at any ends, I can come to a conclusion that the psychosocial intervention definitely will help the caregiver to provide better care, to enhance their well-being, and manage the behavioral issues in well manner in the group setting. And it also decreases the burden of care. They don't need to think that they are the alone here. And in short, I can say that psychosocial intervention definitely enhance the quality of life of the family members and the elderly person with the mental health problems. So these are my references and some of my bibliographies. And thank you, sir. Madam, I can go for any clarification.
Thank you. Thank you. You have finished your presentation within the time, and it was very interesting and informative. So with this word, the topic is open for question, clarification. Participant, if you want any clarification, any question from him, you can raise your hand. Yeah, you can write your question answer in chat box. We have 2 and 3 minutes.
Can I ask the question?
Yes, sir.
Can you just explain how you standardize your SOP?
Yes, sir. When we thought of this group work intervention, sir, we had a discussion in our clinical setting. And I explained that this is also part of my PhD, where I adapted group, individual, and family-based intervention as my package to do interventions. And I wanted to look into this, how clinically it will be feasible. So when I went with the review of literature, and also I prepared a SOP, how I'm going to conduct the group work. And I also shown that this is going to be done in the 3 months of pilot study. Then only we are going to do a actual group work intervention. So we prepared an Google Sheet schedule, and also we prepared 35 pages of that SOP, how we are going to do it. And we discussed with our treating team in our clinical setting, and they accepted. And also it's my study also ethically approved. So it's a part of my research study. So they allowed me to do, and that's how we go ahead, sir. And we maintain all this confidentiality, and also allowing the members to voluntarily withdraw at any point of time. So all those we keep it in mind that, and we conducted the study, sir. And this SOP is being reviewed by our clinical team.
Yeah, thank you. No more questions from my side, sir.
Thank you,
okay,
sir.
So I have one question from you. How you assess the well-being and quality of life of caregivers? Because you have not shared any subjective and objective scales for that. How will you assess in this study? Because you, in conclusion, you say quality of life and well-being of the caregiver after the giving the group intervention, it improved. So how will assess these two parameters?
Yes, sir. One is you asked about quality of life. Another one, sir?
Well-being.
Okay. So quality of life and well-being, these are two different aspects in our variable. In my research, I kept quality of life is one of the variable, and instead of well-being, we kept support system and how to address the loneliness and also reducing the disability. These are the outcome variable as part of my research study. But
So far that you have applied
yeah,
any
I have a
standard
scale,
scale?
sir. We used WHO quality of life scale, and also instead of well-being, we kept functionality and disability. So that is why we looked into UDAS can scale. So these two scale, and along with that, we also looked at these loneliness issues and also the support system, how these four variables can contribute to the progress. So these are the four areas we looked into, sir.
Okay, thank you.
Kanagraj sir
Anyone?
has raised his hand.
Yes, yes.
Hello.
Yes, sir.
Yes, sir. Yes, sir. Please go ahead.
Nice.
Good morning.
Thank you, Chairperson, for giving me this opportunity to interact with Mr. Puttamare Gowda. It should be pronounced like Puttamare Gowda, right?
Yes, sir.
So very nice presentation and very great work. Actually, I want to appreciate. That's why I have come. Actually, intervention research is very rare in social work research in India. You have ventured into a great work, and that to different level. It is something over ambitious, but still, I have a lot of appreciation for your work. So, only thing I would like to tell you is that actually you document qualitatively all the processes you are doing. And then also the profile of the participants of the group. Otherwise, it is fine. And then already our panel of experts have given you suggestion to have that outcome variables clearly defined and assessed. Otherwise, it is a very good presentation, very clear appreciations. Okay?
Thank you, sir.
Best wishes.
Thank you, sir. Thank you for your comments and suggestion. Anyone asked any question? Clarification? Further more clarification from the participant? We have 1 minute.
If I may be, I have just a very small
Yes.
question.
Yes, please.
Mr. Godwa, is it part of your PhD program or a specific research program?
Sir, my research is related to a strength-based healthy aging program. We are developing a strength-based healthy aging program and look into feasibility. We are doing a quasi-experimental research design. Before, because I was in the beginning, I thought of to do it in a clinical, how it is feasible. It is a part of my PhD, but my PhD is different areas. I mean, a geriatry related area only. But this is I tried like a learning phase.
Preliminary work.
It is like a learning phase. I just started my work in a geriatric clinic service. So I thought it will be benefit for me and benefit for a clinical setting. So that learned me actually, it made me experience how to move my study.
Good work. Must say it is good. Thank you, sir.
Thank you. Thank you, Dr. Bhupinder. If there is no question, then we come to the end of this session. So I request to Sandeep sir, please conclude the session.
Thank you, sir. Though the papers were low in number, we got informative insights out of those two papers. I appreciate the efforts done by scholars and their teachers and support staff.
Thank you, sir. Sir, your voice is not clear.
I appreciate the efforts, comments extended by Dr. Kanagraj sir, Dr. Narendra, Dr. Ravi, and the support extended by ISPSW to organize this event. I appreciate them too. Thank you.
Okay. Thank you, sir. Thank you for your nice word. Now, yes, someone.
No, sir, I just said thank you.
Thank you. Thank you. So with this word, this award session is end. Now I hand it over to organizer for further proceeding.
Thank
Dr.
you, both the
Bhupendra.
chairpersons, for taking the difficult task and finishing it. Thank you so much, everyone. And I would like to request all the panelists, those who are in the panel, they can leave the panel and remain in the attendee list. We have our another invited talk, and later, soon after the talk, in the same platform, we have our panel discussion. So now we are moving further for our invited talk. Thank you so much, one and all.
Thank you, sir. Thank you so much.
Senthil sir, I'm looking for you. Please raise your hand so that I can add you in the. Okay, got you. Actually, it is showing like Redmi Note 9 Pro. So that make me confused.
Good morning, sir.
Morning.
Morning, sir.
Yes, Dr. Manoj, your name was visible as Manoj, so I found you in the list, but for Senthil, I was facing difficulty.
Yes, sir.
Okay, everyone. So again, welcome back to our another academic session that is basically focused on some clinical exercise and intervention in the area of behavioral addiction. So for the session, we have two experts. One is our speaker itself, and another one is the chairperson. So we have with us Dr. Senthil M, faculty in the Central Institute of Psychiatry. He is going to chair the session, and the speaker for the session is Dr. Manoj Kumar Pandey, associate professor in the clinical psychology, head as well for the department, and a very good therapist. So without making any further delay, as we are almost 20-minute delay from the expected schedule, I'll hand over the charge to the chairperson.
Thank you, sir.
Senthil,
Thank
sir,
you
over
for
to you.
yes, sir. Yes, sir. Thank you, sir. Thank you for the opportunity to chair this session, sir. And also nice to meet Dr. Manoj Kumar Pandey. Virtually, I'm meeting him after a long time. And Dr. Manoj Kumar Pandey is a very senior person. He has around 15 years of experience in the field of clinical psychology. Currently, he is associate professor and also he is head of the department of clinical psychology and JSS Medical College, Mysore. And the topic is very important in the current scenario. Today's topic is behavioral addiction in India, treatment, research, and public-private efforts. As I said, this topic is very much relevant. That too, the post-corona time, the people have started using this internet and spending more time. That is screening time. It has increased. So it is very well, what is a important topic in the current scenario, and behavioral addictions are equally. It is addiction like any other addiction, such as substance use disorder or any other addictions. So behavioral addictions, such as gambling, internet addictions, overeating, and television compulsion, all those things are coming under behavioral addictions. I hope Dr. Manoj definitely he will present it and then he will give us very in-depth knowledge on this particular subject. So with this, I invite Dr. Manoj Kumar Pandey to make his presentation. Thank you.
Thank you so much, sir. my greetings to the chairperson of the session, as well as I'm very thankful to the conference organizer, especially Bhupinder sir, who has given me the opportunity to be the invited speaker for this talk, which is very pertinent and need of the hour. And without wasting my time, I will start sharing the slides. I hope the slides are visible, sir.
Yes, it is visible.
Yes, yes. So basically, I will be talking about basically what are the behavioral addictions, what are the treatment effort individually, group level, institutional level, and the national as well as state level has been taken in our country, and what are the current research trend. And at last, we will end with the guidelines to curb this problem, which is I call a public health emergency. And let me start this presentation. It's not about uh, only the patients, it's all of our story. It's your story, it's my story, and it's everyone's story. Let me see it through a window of this slide. And we have the reports in my clinic as well as through the research that the smartphone use, the screen time, the pattern has changed. Now the individual start using it in the washrooms also. I don't know how many of you take the cell phone in the washroom. If it is so, then it is one of the indication that yes, you are clinging towards it. And we all know that the bedroom phenomena, when the couple and family is there in the bedroom, they will be sitting in the bed, but their mind and their full occupation will be inside the the mobile screen. And other than that, there is a upcoming and recently researched topic that is called fubbing. And fubbing means, well, you are in the interpersonal communication and interaction, and you are giving priority to the cell phones, and you are giving priority to the screen, then the individuals. And because of that, a lot of non-verbal communication cues which are exchanged between the two partners in any kind of social interaction get disturbed. And in few of the researches which I have conducted here, I found that the partners, even the married couples, as well as the individuals who are in living relationship, as well as the individuals, the youths in the romantic relationship, all share the dissatisfaction in the quality of relationship because of this fubbing. And we have a lot of researches supporting that high screen time, excessive screen time is damaging the quality as well as the quantity of the sleep, not only in the adult but also in the children and adolescent. We will see the recent trend last 5 years research worldwide and in our country also in upcoming slides. And now the smartphone has become a behavior regulation instrument for the parents when the childrens create the problem in the family, and when the childrens are creating disturbance and or uh, creating the disturbance in the family members, the parents day to day household chores and other things, the smartphone become the easiest way to give them, and to make them engaged. That is also very much troublesome and having the adverse impact upon the brain and cognitive development as well as the social emotional development in the children and adolescent. Then if whenever we are going in the public places, we see that even the group of people are sitting but they are headed down towards their cell phone. Because of this, the social interaction reduces remarkably, because we are occupied what is there inside the screen, not what is there outside the screen. And surprisingly, I see when I go to the morning walk, I see the people having the cell phone in their hand and walking, and at the same time watching something that is more important than the lively feeling of the walking. So that is the trend that it is showing. Then we all are aware about the reel phenomena nowadays, selfie and accident. A lot of newspapers, news, electronic print media report it once in a while across the country. And these all things are bringing the lifestyle changes, not only for the adult or elderly, but also for the children and adolescent. And when these things co-occur, they are bringing the effective changes in the individuals, which are durable, which are sustainable, those effective changes, and bring the poor outcome as far the adjustment in different areas of life is concerning. And if we discuss about what these data or what these things indicate about, how we are immersed into the smartphone or screen behavior. And this is the initial slide. Now if we move ahead, what are the psychiatric comorbidity? And if we see here in the second, the third column, these are the individual who are addicted with the internet addictions. And now you see here the psychiatric comorbidity is disproportionately high than the normal internet user. You see, we have a range of disorder from substance abuse disorders to predominantly the disorders, anxiety disorder categories. So these comorbidities indicate us something for the treatment and prevention that I'll be discussing in the coming slide. And now, if we see what is the urgent need of the hour, what are the significant aspects, what the research say, that initially in the first slide I talked about the summary of what I have understood through
Are
my.
you moving the slide, Dr. Manoj, because the slide is not moving?
Yes, I'm
From
moving the slide, sir.
No. What about others? Yeah, now it is moving.
Yes,
Yeah.
now it is.
Now,
Yes.
sir?
Yes,
Now?
yes. Now it is moving.
Now it is moving. Now it is in the slide.
Yes.
Physical
Significant
health
aspects of
component.
the screen.
Yes,
It
yes.
is in the slide significant aspect of screen
Screening.
time and behavioral addictions.
Now, sir, now.
Yes.
Physical health complication, I think this
Yes, it is
slide
there.
name is. Okay, I think I need to put out. Okay, so now
Full
we
screen
will
mode.
see.
Full screen. Full
We
screen
will,
mode.
sir, full screen mode is not visible, sir. That's why I put it into the.
I think
No
full
problem. You
screen
can
is
go ahead.
creating
No
some
problem.
difficulty. You can go with this mode.
Yes. Now, if we discuss about the physical health complications as the research has reported in the recent year, and we see here, it is contributing to obesity, cardiovascular disorders, hypertension, eye pain, back pain, even in low SDL cholesterol, and a lot of other things. And the most important that thing I will highlight here, that the initial evidence are there that the adverse impact in the brain structure and function. This is the important, eye opener for the researcher and clinicians to look into it in a, scientific and rigorous manner. Really, these, gadgets, smartphones are having these changes in the brain and functions of the children. We will discuss about this in further coming slides also. Now if we discuss, my focus basically will be here on the children and the child and adolescent aspect, because there we need to work what I feel through my 10 years of work in the behavioral addiction area, including my PhD thesis also. Now if we see here what the current researchers say, that more than 2 hour screen time is associated with the poor language development in 2 years old, children's. And screen time is associated with poor sleep quality and time, that I have discussed earlier also. Now if we see here, worse health related quality of life, again these all studies are in the children and adolescent across the world. And we will think of how we can replicate the findings, or how we can utilize the findings of these studies in Indian context also. And the greater incidence of the internalization behavior, this is also one of the thing. And lower perceptual motor indication, when the screen time guidelines, what are those screen time guidelines, that we will discuss in the end. But the researchers say that as per the age, there should be different kind of guideline depending on the individual's age. Sir, I would just take 1 minute because the phone is
You can answer the phone. Yes.
yes. Then moving to the next slide, smartphone and the media multitasking is highly associated with the impulsivity, cognitive inflexibility, and reduced decision making. Again, I'm emphasizing these all researches are from the children and adolescent population. Increased sensitivity, severity of the anxiety and depression, that is very well aware across the research across the world. And speech production, that it is again one more study was there, I discussed earlier. This is that Hutton et al. 2022 research is saying that the lower thickness, cortical thickness in the various brain regions, when the children are using the smartphone or digital devices, or in some will say that the screen time, this is very important for all of us to think and to enhance our knowledge and to create a research based ground for the treatment as well as the preventive steps. And TikTok, we are very aware, this is a very famous app, we all know. There are ophthalmological risks also. The eye injuries and vision problems have been reported in those individuals who are excessively using this particular social media app. Now we will see the co-occurrence of the behavior addictions. When I'm talking about the co-occurrence, I'm talking about the comorbidity of the one behavior addiction with the other kind of behavior addiction. In the last column and the last row of this slide, we see that what is the common co-occurrence or what is the comorbidity among the behavioral addiction. This is indicating something for us, which I will discuss in coming slide. Now, if I talk about my own research, which I have been conducting here in GSS Medical College since 2020 when I joined here, this is one of the data from one of the MPhil research, which I started to develop the indigenous assessment tool for multi-behavioral addiction, which is in the process of publication. Here we see that the social media was prevalent in 8% individuals, around 600 is the sample size, pan India is the sample size. Internet addiction huge, 32% individuals or the child and adolescents were found to be positive for this. Pornography, which is little bit high than my own expectation, 27%, around 27%, and smartphone addiction is here 11%. So this is the data of Indian adolescent and children and adolescents, which we have just 1 year back. This is the 1 year back data. And now from the same study, if I talk about the co-occurrence of these conditions in Indian adolescents, which is a challenging situation for all the clinicians. If I talk about the gaming, whether that is the online or offline gaming, it has the high association with the smartphone addiction, online romantic addiction, social media addiction, internet addiction, and pornography addiction. Similarly, if I talk about pornography, it has high association with these five, sort of behavioral addictions, or I say sometimes the digital technology addiction. Now, what these, intra or intercomorbidity or co-occurrence are indicating? These are indicating that there are high vulnerability to addictions. Means we need to look at that the devices are not addictive actually. That the content in the internet platform is not addictive actually. That the traits, the underlying factors, the underlying vulnerabilities, these are the things need to be addressed even in the treatment or for the prevention, whether we call it primary or secondary prevention. We need to look into the vulnerabilities. That's why the comorbidity is indicating that if there is an addiction, it should be for only for one type of gadgets or one type of substance. I think missed that slide where there was high comorbidity between the substance and non-substance addiction also, which I call behavioral addiction. Then another thing, what can be the underlying issues? Traumas, depression, anxiety, lower self-esteem. These all others, things can be the underlying factor which are motivating for the individual to be, inclined towards one and other sort of behavioral addiction. And very interestingly, across the research worldwide, what I have understood that these gadgets and these sorts of behavior are used for the mood modification. That is very important thing to be noticed. And if we talk about the substance dependence, obviously the major component the individual use the substances for the mood modification. Now when the mood modification is required, we all are clinician, we know that at the time of the stress, at the time of the when the individual are going through certain frustration, that source of frustration can be anywhere. That can be the occupational source, that can be the familial, that can be the interpersonal, that can be the academic, that can be the any source of. But there are certain underlying causes we need to address while we are talking about the treatment and challenges. When I took the first case of the internet addiction in 2013, at that time the parents and the children came with the complaint that the child, the adolescent uses game very frequently, and it cost a lot of important quality hours of out of 24 hours per day. Then when I started the treatment, I saw that yes, it is the thing. But when we went in enhancing the therapeutic alliance with the client, I came to know in the coming session that real addiction was toward the pornography, which, and I wasted my time at least 5 to 6 sessions on dealing one or two particular component. But later on I found that okay, the addiction was toward the something else, with the client was not able to easily open up to the clinician even after the 5 to 6 sessions. Then I thought that yes, there is a need of such tool which can assess the proportion of the addiction towards different platforms of digital technology, different apps, different these things, so that we can get a inclination of the cutoff scores for the different sort of addiction, so that it will help us to be very specific and targeted in the treatment from the beginning of the treatment. That's why we are in the process of developing the multi-dimensional scales, and I think in future it will be in the public domain also. Now these are the background story, what the researchers are saying, what our empirical clinical experience is saying about the behavioral addiction in the children and adolescent. Now what are the challenges? I don't think that India is not doing the research in this area. Yes, there are a lot of effort from the AIMS, New Delhi, NIMHANS, and other medical college and institute of primary importance, and psychiatry training institutes like CIP, RINPAS, IBHAS. All individuals are doing, all the institutions are doing some effort, but still, if we see this slide, I was very much surprised. This is one of the article from BMC, which is highly reputed publishing house and journal. This include the data from worldwide across the nation. What is the prevalence of gaming disorder and internet gaming disorder? And we see here, if you see in Indian subcontinent, there is no prevalence data found. This is very surprising for me, and this research is not a very old one. I think it is of 2023. Now, this is the question, why it is so, even after our consistent effort, why we are not able to represent at the world level, at the global picture, why we are not able to reach there up to that. So this is the question. I will not answer to it, but I will ask all my teachers as well as my professional colleagues to think upon it. What are the things that, is not highlighting our research work, and the BMC, the individuals who have published this article in the BMC could not find a single study on the prevalence. If we see, there are a lot of studies available in the Google and online platform. So this is one of the challenge for us. Then what are the other challenge? I talk the challenge in the assessment. We have lack of indigenous, standardized, validated measurement tools. This is not only about the behavioral addiction, but other part of the psychiatry, other part of the psychiatric social work, other part of the clinical psychology practices. We have a lot of tools which are developed in the abroad, and we adapt it and we use it. That is a good scientific temper, but we may differ culturally, we may differ, as far the trend of the society is concerned. We call it as a collectivistic society. There is a need of development of the indigenous tools, and that's why the researchers what we do uh, lacks the unanimously acceptable measurement tools. Because of that, we see there is a variable and less reliable data on the prevalence, demographic correlates, risk factors, protective factors, and treatment outcomes. So my emphasis here is we have the need of few reliable, psychometrically, well established tools which can be used in the multi-center, because there need a task force to be developed. Even there are suggestions for the government, there are suggestions for the clinician and researcher. So my emphasis should be to develop indigenous measurement tools to reach to the grassroots level to understand the problems. Now, again, all we are all of us are aware that what the stigma play a role in the treatment, management, and prevention of the psychiatric and mental health issues. The similar thing applies here. Lack of awareness of what? Lack of awareness in the individuals that smartphone or the screen time can also be addictive. This is the lack of awareness among the individuals. And if we check the parental digital literacy, I am very sure that it will be at very low level. And why it is so? Because we have not given attention to it. Researchers have not given attention to it. What is the digital parental digital literacy? Because this literacy guides how the parent will behave with the gadgets and behave with the children. How the parent will make a harmonious union between the child's play time as well as the child's screen time. So this digit, and what will be the methods, what will be the monitoring ways the parents can use. This is also one of the area of the research, and I request the researchers and the professionals here to look into it. And I didn't find good literature on the parental digital literacy in our country, and I request for all of us to go into it and to assess it, because if we have to curb this issue, we have to address the parents. Otherwise, we will not be able to curb this issue. Then other challenges, unskilled manpower. Like if we talk about the anxiety, depression, and other substance like alcohol dependence and cannabis dependence, we have the treatment guidelines, and we have the models of treatment. If you talk about the psychiatric social work care, we have the models of treatment. If you talk about the individual, or if you talk about the family education, we have the sufficient information that can be applied. But this is lacking when we are talking about the behavioral addiction. So there is a specific need for development of non-pharmacological models, individual treatment models, family education models, and public education models. These are the need of the hour. And similarly, the lack of skilled manpower. We can see here that the specific attention to this behavioral addiction training hardly given in any of the educational institute in India. Whatever the focus is given in it, it as a part of the whole psychiatric spectrum disorders, but there is a need for the specific, attention to this area. And I have few of the stories from the other countries. Like if you talk about the South Korea, they have started the camp come rehabilitation setup to handle these, smartphone and behavioral addictions issues in their country. And if you talk about the UK, National Center for Gaming Disorder, they have developed, and these centers are running across their country and contributing a great for the national or the public health interest, awareness and prevention. If you talk about this as a public health issue, now we should not be very much sad. We should be happy. Even we are underrepresented at the global level. I have came across with some of such interaction with the individuals from the other countries also. If I talk about, I had interaction with one of the professor from the University of Nottingham, and I would not take the name of the individual. He's a stalwart in the area of the behavioral addiction. When I discussed about the research trend in India, and he told that the research in the India lacks the quality of scientific rigor. Then that issue has pinched me, and I am working towards that whatever I can, and I will request the other professional across the discipline boundaries to come in the board and be associated for the research in this particular area. I'm very open for multicentric research projects also. And the government of India is also playing a key role. Recently, we have had the ICSSR proposal for the research, which is targeted for 2047 Biksit Bharat Abhiyan, and they have a very good model of interdisciplinary research. And these behavioral addictions can also be included in such kind of research call. If anybody in the audience is from the policy making, I would request them to include this point, because it is the need of the hour. Now, these are the two major initiative which our country has done. Number one, we may be aware about the shut clinic in the Nimhans, which is providing the the individual treatment, family support for the behavioral addictions. And another recent work has been done by New Delhi AIMS in collaboration with the WHO. They have provided this behavior resource hub. Basically, the target or the aim of this research hub to assist the researcher, assist the stakeholders who are working in this area. But when I searched in the researcher, then only I found it, but its visibility is very low. I don't know how many of us in the online platform here are aware about these two steps. And so there is one need of the hour also. Along with that, suppose this is one of the steps taken by the aims, that to publicize it is also one of the important thing, so that the things come to the knowledge of the common researcher, which the common man, so that the partnership for the multi purpose approach could be addressed. Now, government of India also have taken some initiative. Ministry of Education has issued the advisory for the parents and teachers, demerit of online games, do's and don'ts. But these are the steps in the infancy stage. I will say we need to move from these steps towards a curriculum based development and all other things that I will be talking in the coming slide. And similarly, the Ministry of Health and Family Welfare has issued the guideline for treating substance use disorder, including the behavior disorder. So this is one of the very interesting things to see, that yes, there are the people in the ministry, as well as there are the people in the policy making, who are aware of the prevalence of this problem. That's why it has been added into this guideline they have issued. Now, I would have some recommendation for all of us, including all the stakeholder, whoever is present on board, off board. I would like to share my PPT to the organizers so that these PPT can be, distributed to the across the people, whoever is willing to be associated or whoever is willing to do something to contribute in this area. I'll be very happy to go for that. As well as if there is no collaboration, still the individual can work, because we need the work to be done. And one of the model what I found very interesting, which is a trans-diagnostic model of the treatment of substance and behavioral addictions, and it is published in the Frontiers in Psychiatry in 2018. Now, this is a multi-component model. Such kind of model need to be, conceptualized by the higher academic institutions like IIT and IIM, and these model need to be, experimented through the RCTs or field trials by the training institute like NIMHANS, like other government medical colleges. They need to, apply it to see its efficacy, to see its effectiveness in Indian, culture. And these collaborative effort will help us, because why I am talking about very interesting about the trans-diagnostic model, because we saw a few minutes back in the previous slide, there was high comorbidity among the behavioral addictions as well as the across the other with the other psychiatric disorders. That's why this transdiagnostic model and transdiagnostic work will help us to address the multi-comorbidity issue here. Now, what are the other need of the hours and recommendation for that? Number one, I think the PPT is visible. The parental awareness and involvement is very much important. The research says that the fearful attachment style and poor parent-child relationship are the predictors of the behavioral addictions. Okay, so parents need to be educated that what are the signs and symptoms of the behavioral addiction or excessive inclination towards the digital gadgets, and they should be educated about what is the importance of the balanced lifestyle. We saw that how the digital devices are creating the disturbance in our sleep, and by the sleep they are creating the, emotional behavioral dysregulations in our children. That's why the parent, their involvement, their awareness is very important. Another point, the large scale research is required. Like we had the National Mental Health Survey, I think in 2015 or 17. I'm not able to exactly remember the date. The next National Mental Health Survey must include the behavioral addiction. Each one of the survey area, they have assessed the substance addiction in the previous National Health Mental Survey, but I will suggest this time they must include this so that we come to know the prevalence, risk, and protective factors, as well as we need to look into the self-help strategies. We need to search the successful examples in the children, in the parents who have been using a smartphone, who have been using the digital gadgets, but at the same time they are not falling into the addictive categories, they are not falling into the dead severities. It means they are the model individual, they have the model behaviors. We need to search such, population, such sample from the society and the community, and to think of those behaviors, attitude, beliefs which they have, which are helpful to maintain the normal use of these gadgets. And using this positive psychology or positive mental health approach, we can also develop the growth oriented treatment models so that we can utilize the findings of those things in simple giving the educative guideline, or including the skill training, family management systems. So this will help us. Now, for the researcher, what is the needs of the hour? The longitudinal studies need to be conducted in India. I didn't found hardly a single study in Indian continent or in the Asian, in South Indian, this continent, where the longitudinal studies had been conducted. And we know that what is the clinical and research importance of the longitudinal studies. And researchers need to develop the cultural sensitive assessment that I have already discussed in the previous slides, and we need to explore the genetic and environmental factors which are influencing in one and another way these behavioral addictions. And clinicians, they should use the evidence-based interventions, use the family education, make the family members an integral part of the whole treatment package. What I have learned from my own effort to deal with the individuals who are overusing the technology and overusing the screen time without involvement of the family to treat the individuals, especially the children and the adolescents, is very difficult. And for the policymaker, there should be the national guideline, there should be proper allocation of the fund, and we all are aware about how what are the methods and ways the government issues the fund. But I'm happy that in recent few years the fund allocation has been increased than the previous time. I hope that is this will be allocated to this particular area of public health concern. And if there is a need to regulate the digital content whenever and where it is necessary and where it is hampering the proper growth and development of our children and adolescent, the government must think upon it. And if we talk about the other effort to be done from the government side, school-based program, I'll be discussing one of the school-based program we have launched here in our GSS Medical College. I am the lead coordinator of this program, and what we are doing, we will share the information so that the similar models or improvised model can be replicated to the other educational institutions across the India. And there's a need of the collaborative partnership between the NGOs, government, and private sectors to address this issue. And if I talk about a specific guideline for the NGO, they need to develop the peer support groups to address this issue. Because when we are talking about the digital addiction or when we are talking about the behavioral addiction, we are not only focusing on ourselves on the addictive component of it, but the other the adverse consequences. Like if you talk about the teenage digital abuse, digital dating abuse, teenage digital dating abuse is one of the burning issue that our children and the youth populations are suffering with. And that where we need to develop this peer group support so that the individual of the same group can share their issues with the peers, and that can be done through the effort from the NGOs. And schools should train the teachers and staff how to identify the early signs of these problems. And there should be integration of the life skill educations, especially focusing on how to regulate their emotions. Because again, I discussed that mood modification has been one of the key pillar out of the other motivations behind use of the smartphone or the digital screen time. Now teachers, again the same thing which I have discussed. Parents, they must know to set the clear boundaries. And we cannot we cannot prevent giving cell phone to our children. It is not possible, because in other hand the smartphone has a lot of things for our favor, lot of things for our which help us in our development and growth. But I am today only talking about the dark side of it, so that we can be, aware and do something to take care of these things in future. The parents must know where they should set the boundaries. And the researchers are saying that if the co-viewing is there, means the child and parents simultaneously or use the same digital device to see the content, that helps the individual going into the severity or going into the addictive ranges. And that need to be replicated in India and looked into it. And they need to encourage that healthy habits. And most important, when they know that it is hampering their routine work, their other life, the children's routine work, they must seek the professional help. Public awareness and education, electronic and print media can play a great role, and which is not very much apparent in this case of psychiatric disorders in general, or in case of the behavioral addictions. And these are then one important thing, that initiative we all are aware about, the Telemanas initiative by the government of India, and NIMHANS being the nodal center for it. They must include the behavioral addictions assessment inquiry. Whenever they are getting the calls, they must have one of two questions to address these issues, and depending on the response, the further add-on can be made, because the Telemanas handling the digital problems through the digital media will be one of the great effort. And these are the things. Now this is one of the effort we have done here in the GSS Medical College since last 2 years, and what we call it GSS MAN, Mental Health Awareness and Nurturing Program. Basically, this is a two-wing program. One is targeted on the teachers training, that we call Chitta, and another is targeted toward the student support arm, that we call the Swasta. And under this, we are targeting our around 90,000 students across India and world. We have kept a big team, and we are doing it with the support of the administration, and we are recruiting the staff and manpower for it. We are developing the strategies how to go to the reach to the masses, and we are getting a very good response. By the time we have trained 400 teachers at 5 primary and junior high school level to be the school mental health facilitator, and behavioral addiction is one of the major component of this initiative we are doing here. And with this, I would like to thank to the organizer and chairperson of this session, and back to the chairperson and the organizer. Thank you so much from my side.
Thank you, Manoj. Thank you, Manoj. It was a very good presentation. You have covered all the areas very nicely. And such as this increasing screening time can lead to various problems. Especially, you have covered this topic for children. The increasing screening time for children can lead to various health as well as mental health issues, and how to handle these issues in terms of how to work with the teacher, how to work with the parent, and the government, and the role of the government, policy makers, all those things. So you have covered this topic very nicely. I hope it must have helped our audience. And I believe also there must be a lot of questions and clarification. So I invite, if there is any questions and clarifications, so you can ask Dr. Manoj.
Okay, I think before anyone else asks, I just grabbed the opportunity. Manoj, I have a question in my mind. Although we are talking that a lot of things, that these things are good, bad, and all. Would you like to suggest any software or any such kind of gadget or things which can be used or utilized by the parents, especially that growing children parents, which may help them to prevent such negative aspects and utilize the positive aspects of the gadgets? Anything that can be helped, because it is not possible for parents like me to keep an eye on children all the time. So anything that can help them.
Yes, sir. As far the such software is concerned, I am not aware of the availability of such softwares or such apps which can help the parent to navigate the children's digital behavior, as well as to guide them how to assist the digital parenting. I call it digital parenting. But there can be there, this is, I think, well aware to the all of us, that there are parental control systems in all the apps. If you talk about the YouTube, there are parental control, and you can put the thing there, and that will help that the children doesn't move toward the unintended content, especially if the exposure toward the sexual content is premature and before the age of the maturity. It is going to have the devastating impact in later on development. So that is one of the key concern, and that can be done. And we are, sir, doing the fundamental research in this area. and this is targeted on what the parents know about it, and through the focus group discussions. And I request the sir also that we can go for a collaborative multicentric solved project on this particular issue. What are the parental awareness, and we can develop the app also. And I will go to the literature and get back to you, sir, with the more solid and scientific answer, because
Here, the
whatever I
prevention
know
is
till
very
now, yeah.
important. Here, the prevention is very important. Generally, we as a parent, we makes actually mistakes. To get free time from the children, we are actually making this mistake. We are giving phone to them, and then we are making them as addict actually. So it is a responsibility of the parents to not to give the what to say mobile phone to the children. Their physical activity, it has come down. It is not like actually our time. We used to go outside and then we play lot of what is a physical activity has happened. Now it has come down. So here the prevention activity is very much important, and we should create awareness to the parents actually. So that is very important. Instead of looking for any app which can help the children, we should go very basic, what is in a practical solution that we have to do.
Yes,
Thank you,
yes,
sir.
yes.
Because I have seen in many of the news, in the day-to-day news, we are seeing that actually some of the children, they are even committing suicide. Because it is a mistake of the because abruptly you are snatching the phone from the children. No, you have allowed the children to use this phone for at least 2 or 3 years continuously, but all of a sudden snatching the phone from the children, it has created some emotional issues to the children, and then because of that impulsive nature, they are even committing suicide, which is very much worrisome. Huh? Yes, sir. Yes, sir.
Yeah, yes, sir, yes, sir.
Right.
So that's why, sir, actually, there are the basic research is required in this area, taking the, our cultural and our indigenous practices is concerned. And parents, again, digital literacy is one of the important factor to be addressed in this area. That's why I didn't find any kind of research. I searched it, not now, before 2 months back also I was looking into some. So that's why then also I didn't find any kind of solid literature in that regard. And this problem cannot be curbed until the parents are not addressed, because very important. Why? If you talk about the alcohol and other substance abuse, few of the parents use that, but the frequency of that, but in the home, the substances, but the mobile phone is our need, and we cannot go away from it. So what I found in my child, co-viewing is very important, and time allocation is very important, right? And there are guidelines, scientific guidelines, as per the age of the child, how many hours the individual should be given to prevent the further damage to the individual's development. So those guidelines, if you follow, and co-viewing is very important. What I do, I go and sit with my children, and sometime what she does, she is 5 years old child, and what she does, she looks the content of her own interest. आजकल तो बहुत सारे आते हैं, क्या नाम है, बच्चों के लिए. So then when there are some aggressive component and all other things, and she know that these things are not liked by the parents or mom and dad, what she does, she hide the cell phone. 5 years old child, right? When I saw it, then I thought that yes, it's very dangerous for the coming time. So let's we start the co-viewing. Then she and my wife started giving the at least half an hour time in the evening together to see it, so that the need to use the cell phone and needs to be, because what happens, why it is so much attractive for the children, because it is highly stimulating for all the areas of the brain, right? And that's why the co-viewing has been very important, and setting the timeline, and then again using the principles of the behavior therapy, that works, sir. It is working with me. I think we'll be working with the others also. The co-viewing is a very important, what I found through the research and through my own experience, sir. Yes,
Yeah,
thank
yeah.
you so much, sir.
Although you have highlighted so many what is the problems which can lead to this increasing screening time can lead to various problems. Still, I would like to highlight some of the issues like from your own what is a presentation for our audience what is a perspective. This excessive screening time can lead to language issues, which we have seen in our day-to-day our clinical practice. And also this can lead to sleep, what is a quality of sleeping time. So further, because of that, the children may experience what is a irritability, and this can further lead to academic decline also. Frequently, we are getting complaints from the teachers that your students is not performing well in the classroom. So that is entirely because of the increased screening time. So this is another issue that, and also for the extent this can lead to autism disorder also. Yeah, in the disorder wise, if you talk, the symptomatic wise that I have highlighted, but disorder wise, this increasing screening time can lead to autism disorder, which for that actually the doctor is advising that you have to reduce, the parents have to reduce the screening time of the children. Particularly, not to abruptly, you cannot snatch the phone from the children, but you have to go gradually, you have to reduce the screening time. So that is advice from the clinical practitioner. That also I would like to highlight in this time. Although you have highlighted so much of what is a behavioral addiction, so only that the internet addiction that you have very what is in a you have covered this topic in a detailed manner. But the gambling also is one of the issues which we are seeing in the especially during the IPL time. We are seeing in our day-to-day yes, the time is actually we are running out of the time. So I am stopping here. That gambling is also one of the biggest issues. Yes.
Yeah, yes, sir. I accept that point, sir, because I just took it as an umbrella term. That's why that is very important. We had a patient admitted here in the pediatry ward for the gambling addiction. The child didn't reach to the adolescent age, but this was that case is recently 2 days back. I saw that is the first case I am seeing for the gambling addiction, sir. I hope that this gives me the new learning.
Yeah, yeah. Any last moment question from our audience? Actually, we did not give chance to our audience.
Senthil sir, sorry to interrupt, but I think you can't allow audience to ask any questions because we are running 13-minute delay from our
Okay,
schedule.
sir. Okay, sir. Okay. So thank you so
please
much,
put your
sir, for this
concluding remark.
presentation.
Thank you.
Yes, sir. Yes, sir. So thank you so much for this wonderful presentation. And you have covered, as I said, you have covered this topic very nicely, sir. Once again, from the ISPSW family, we are thanking you for this wonderful presentation. Thank you, sir.
Thank you so much, sir. And again, I will request here that can we go for any of these area for even it is if it is not the funded project, we can go for the small scale research because something is better than nothing. Multi-centric, which happens in the north, east, south, and all part of the country, it will be great. I think Bhupen sir is running short of time. उनको खुजली भी हो रही है. Sorry, sir. I'm
No,
stopping myself here.
just
Okay.
actually, although we are running short of time, but one thing I must have to say, while you was presenting, then I was thinking that it is a topic which need a whole day or at least half day. So to concluding in 1 hour is very difficult. So I would like to request you, we can plan a session on parenting in this fortnight and we will deliver it for the general people, especially for the parents and all. So we will chalk it out and announce and we will come to the audience later.
Yes,
For
sir.
now, I have to thank both of you, to the chairperson for handing handling the chair very beautifully, and for you for a very beautiful presentation which raised several questions in my mind. So I hoping that the similar kind of questions in several people's mind. That was very wonderful presentation, Manoj, and it was looking in
Thank you
your
so much.
slides that you did very hard. Thank you so much to both
Thank you.
of you. Thank you so much.
Okay.
Okay, dear friends. So as I admitted that we are running behind the schedule almost 15 minutes. So without any further
Sunil
delay,
also. Bhupendra, Sunil. Sunil, please raise your hand. Sunil Prasad. Come.
He is already here.
Namaskar, sir. Namaskar, sir.
Only one panelist whom I am not able to find is Grace L.
Yeah, Grace has some work. No, they see her father is not feeling well, so she has gone
Okay,
to
anyway.
take care.
So
No,
if you have any replacement, let me know. I can add him.
I tried, but it's too late. Okay. Too
Okay.
short notice. No, we cannot invite. So we can manage with that. Madam Sultana, please. Professor
So
Sultana,
here
please.
we are in our panel discussion too, and for this panel
Sir,
discussion
I'm ready,
we
sir.
have, yes, welcome, ma'am. So for this
Thank you.
panel we have a very good and a strong panelist. Chairperson for the panel is Professor Sahin Sultana, and along with her, Dr. Devendhiran, Professor Ganga Bhushan, Professor Ratna Huriam, Sunil Prasad, and our President, Dr. Kanagraj itself. So, sir, over to you and the team of the panelists. Thank you. You are
Sir,
mute,
you
sir.
unmute.
Thank you, Dr. Bhupendra ji, for coordinating our program very efficiently. Today we are having the second panel discussion on innovations in teaching, learning, and assessment. Actually, this is something, we don't discuss generally how to teach and all. No further refinement of teaching, learning, assessment process is needed in the digital era. So to chair this session, we have Sagin Sultana, and we have resource persons, Professor Devendran, my colleague, Professor Ganga Bhushan from Assam University, and we have rapporteur Dr. Sunil from Assam. And now I request Dr. Sunil Prasad to introduce our chairperson.
Sir, am I audible, sir?
Yes.
Okay. Namaskar to all. Respected Professor Sain Sultana, ma'am. First of all, hearty welcome to you for this today's panel discussion. So, just a brief introduction about ma'am. Professor A. Sain Sultana, ma'am. She is from Pondicherry University, and she has got over 15 years of teaching experience in teaching, research, and fieldwork in medical and psychiatric social work. She teaches psychology for social work practice, social policy, social welfare administration, medical social work, and public health. Professor Sultana ma'am also excels in designing and evaluating educational programs and instructional methods. She creates collaborative and interactive learning environments and has extensive research experience in social work curriculum development. She has collaborated with institutions and organizations at national and international levels. She has many accolades in her name. From publications, she has got many international, national publications. So, ma'am, hearty welcome to you for this today's panel discussions. And I hope your experience, such a bit different experiences of over the period of span of time, would enrich us and contribute towards our motive of Bharatikarana social work through innovations in teaching, learning, and assessment. Thank you. Over to you, ma'am. Thank you so much.
Thank you. Thank you, Dr. Sunil. And a very good morning to one and all of you. I can see Professor Kanagraj here, Professor Devendran sir, and many other distinguished guests here. Thanks, sir, for the opportunity provided. And I think this conference has been very meticulously planned. And I think in a very short period, the entire department has worked on it very positively and constructively, and I can see it going in a very positive note. So appreciations and congratulations to the department and to all one of them who have worked on this. And I think I've been given the responsibility to have the panel discussion on innovations in teaching, learning, and assessment. The main objective of this panel discussion is to dwell into the innovative approaches in teaching, learning, and assessment within the field of social work education. Basically, what we are attempting to see is that the panelists have to share their experiences and strategies in enhancing the effectiveness of social work teaching methodologies, which means integrating the micro and the macro practice methods, and also to look into incorporating the social science perspectives into the curriculum. The objective of this panel discussion is to have a more dynamic, engaging, and impactful learning environment. Ultimately, we are working for the social work students in the Indian context. So, with this small introduction about the objectives of the panel discussion, I now welcome the senior panelist, Professor C. Devendran, Head Department of Social Work, Mizoram University, who is going to present his views about teaching, learning, history, and philosophy. And just to introduce Professor Devendran, he is a professor and head of the Department of Social Work, Mizoram University. Sir holds a PhD in social work from the University of Madras, focusing on leisure and recreation patterns of Mizo youth. His research interests include youth development, rural development, as well as social work research and youth livelihood. Sir has published numerous books, chapters, and research papers and has supervised many PhD and MPhil students. I'm very happy to invite now Professor C. Devendran to present his insights on this resourceful topic. On to you, sir.
Namaste, ma'am. And Chibai, and good morning. Am I audible?
Yes, sir.
Yes, sir.
You're audible.
Yes, sir. Yes, sir. Yes.
So first of all, I would like to respected chairperson for a beautiful introduction about me, and I also thank the organizing, the president of Ispsw, Professor Kanagaraj, my colleague, and also the other organizing team members. As the chairperson said, it was very meticulously planned and conceptualized, I could say. So I would like to thank, and it is my time to discuss on this topic, innovations in teaching, learning, and assessment. This particular panel discussion having a very important area. So this is particular topic is based on my views and thoughts how social work education should play a vital role in terms of three aspects: innovations in teaching, learning, and assessment. So you know that social work has completed its existence in 88 years, which means it is 9 decades almost. So in that particular way, it is time still after 88 years of existence as a social work discipline in some of the universities and colleges and departments and private universities, deemed universities, still there is a room for develop our own Indian context. It is still remain to be localized. So there is a adequate resources need to be developed. So in that particular context, the philosophy and history of social work, when we look at it, it's a vast area. Each and every continent is having its own history and its own philosophy, how this social work developed, how this social work existed in various regions and various continents and even in our country. So it's as the topic itself is very vast, and also with my little experience, I'm not very good in history and philosophy, but I want to do some justice in terms of with my little experience of teaching and still learning as a student of social work. And then lots sort of innovations can be done in this digital era, especially for this particular youth, student youth. So in that particular way, when we look at the social work, little I would like to talk in a just manner. We are facing a lot of challenges related to social work education practice, in especially in curriculum designing, teaching of field practice, research, and also accreditation and registration. Still a lot more work has to be done, especially why the social work. Still there is a lack of knowledge among the general public, even among the educated people, how this could be conceptualized, especially what is social work. Because India is a very vast country and having a lot of religious background, philosophy, and also issues varies from states to state. So therefore, and also it has got its own globally connected and nationally state-wise lot of issues, and also very multicultural pluralistic society, complex in nature. So therefore, there are so many issues arising in this uh, new digital era. After COVID-19, the students of social work facing even challenges in terms of sitting in the class. This was I was observing for the last 2 years after this post-COVID-19 effects, impact. So in that particular way, I would like to throw light on certain aspects before entering into the social work. So, in Indian context, social work has got its own meaning for a general public. General public think that I'm also doing social work. When I was here for the last 2 decades in northeastern region, I'm also doing social work. We call here in the local language Natlang. It is like a community work, or sometimes we in our Indian context we say that Shramdan. So people have different connotations of social work. So in India, social work, it is not a paid work. It is not a profession considered. This is a big issue, debate still going on. Still, there is no recognition. We have to license our own social work profession. So keeping in view all these things, the issues at present coming up, when we see human rights violation, gender discrimination, persons living with HIV/AIDS, environmental destruction, crisis of governance, effects of globalization, so on and so forth. So many times these issues are interlinked, and also many other social workers come across poverty, problems of industrial workers, migration, poor health service, malnutrition. According to Professor Sarkar in 2005 was mentioning, and also earlier various religious issues are also coming up in the. So we know that ultimately the social work is started with working for the poor, for the underprivileged privileged group. So we have to get a more clarity on this by reading literature, the available resources. So first of when I was teaching this particular aspect called social work profession, foundation for social work, and philosophy and assumptions of social work, sometimes it leads to confusion which one to follow, whether Western ideology or it should be a Indian ideology. Or so I sometimes it is not that much clear when I was. So there is clarity is needed. And social work usually in Indian context, it is coming from heart and from the mind of the people. So it has got its own understanding. So therefore, conceptual clarity about social work and their related terms first, as the people have to understand, and understand the history of social work profession in India and West, and understand the values, ethics, principles, functions of social work, and consciously these things to be applied in teaching. So in that way, now when I come to these are the issues. In order to address these issues, innovation in teaching, history and philosophy. Many of the students, they do not like history and the philosophy, because it is something today, the mindset of the youth is, the mindset of the today's digital students, those who are studying now, they find it is something they are not interested to this. So it is the teacher to cultivate some type of motivating and making them to be interesting in this particular, especially in history and philosophy, because these, without knowing history, we cannot understand how the root of social work, the root cause for beginning of the social work in various regions. Therefore, it is essential. And so in that way, now we should use creative methods in teaching. We are in the era of globalization, we are in the era of technology. And so we can use a lot of other teaching aids. Nowadays, this artificial intelligence is playing a vital role in every way of teaching. It makes easy the way. At the same time, we have to humanize our own thoughts and ideas based on, because this social work is basically emotion, feelings, relationship, and it is intertwined with many other factors, cultural relativism. So in that way, a lot of things to be used in creative methods. Say for example, storytelling and can be used. And nowadays, this particular student youth, they cannot sit for a long time, just for 12 minutes. Science tells us they cannot concentrate more than 12 minutes. So even if you see the YouTube channels, whatever it is, they cannot go for more than 12 minutes. So in such a way, we have to prepare our own teaching aids using the smart board and other aids to make our own clippings, or ask the students, children, I mean the wards, to make their own topics on giving the concepts related to social work, how it has begun, and in order to get more clarity. So the understanding the history of social work profession in India, let them make their own available new resources which is available. So let them make their own understanding, bring them the whole concepts as a glossary of terms, and then reflective thinking of the concepts. In this way, the new techniques can be used, innovation techniques, new information and communication technologies like the gadgets like smartphones, social media, artificial intelligence, as I said earlier. So this is playing a vital role in order to use, collaborate with the persons, and in also with the students in group way, giving assignments. And also, instead of, they do not like this lecturing type of teaching every time. So they need more new informations, new way of techniques. This is the today's mindset. If they are expecting from the teacher, in what way it would be new. They don't want the traditional way of doing things. Therefore, according to this context, the teacher's duty is to update the new information using this technology. So generate materials, asking them to generate materials, and the using glossary of terms to be developed in social work discipline, especially in Indian context. So Northeast, just I gave an example on Natlang. In the same way, other way of, say for example, in this Northeastern context, another concept we call this Longaina, which means selfless service to the people. We cannot, each and every Northeastern states, they have their own unique way and unique culture, unique way of helping each other, mutual understanding and empathy, all these things. So therefore, Indian religious and social work practice has to be given more thrust. Sometimes we have to know, it is a vast area. I don't want to go further in this aspect. Hinduism and social work, Buddhism and social work, Islam and social work, Christianity and social work, Sikhism and social work, Jainism and social work. And then in that way, history of social work in ancient period how was. So keeping all those things, how the social work emerged. And then in the medieval period, how it started, how people were. Social work in a post-independence period. So recently, last year, we organized one of the national level conference. In that particular conference, we have displayed some placards and posters in a calendar form about the root of social work, who are the great personalities. The same way, we can also ask their own case studies of certain personalities, like Western social workers like Mary Richmond, and then Indian social workers, how they started in terms of Mary Clubwala, Mary, the Guild of Service, who started the Mary, I do not know the exact name. So these particular people, personalities can be used to portray their pictures. So in that way, we can develop our own resource materials. Apart from that, learning, when we look at learning, leading social workers charts to be produced, video animation programs, and using of chat GPT. Recently, this chat GPT is giving a very important information to organize the data which are available, and also content-based question making. These are all the techniques can be used. And learning, in terms of learning, when I was reading some article, one of the important educationalists, he was mentioning 5 important pedagogy in teaching approaches, which is to be used in social sciences teaching. That is in the year 2023, he suggested 5 guiding principles and methods to be used. One is called constructivist approach, collaborative approach, reflective approach, integrative approach, and inquiry-based approach. So in this way, I would like to give some of the important aspects where the author, what he emphasizes. Constructivist method, which plays on active creation of knowledge by students through their experiences and relationships. And collaborative methods promote students collaborate and social engagement. So through this way, we can ask the students to emphasize on active constructing knowledge through experiences, interactions, and reflections. These 3 components to be imbibed based on their experiences. They can interact. What is the concepts related to, especially in history and philosophy, giving resources to them. This approach encourages students to explore, discover, and make meaning for social work rather passively receiving informations from the teachers. That's what this particular constructivist approach will be more applicable in the Indian context and in the classroom teaching for because we are living in a cultural diversity is quite high. Let them get more clarity on this. Different culture. Teachers design a project based on this learning activity. And then second, he was talking about the collaborative approach. This collaborative approach already, this is very, in education pedagogy, it is very much applicable everywhere we can see it. But in Indian context, for especially in social work, it is needed because we have to learn a lot of ideas, views, and it promotes social interaction through this collaborative and cooperation. Shared knowledge can be shared through students, and also it will develop a School of Social Sciences. They can develop their own collaborative approach in order to understand the climate of change, especially how the concepts are changing nowadays. Designing a collaborative learning project. Students are divided into small groups, and through that, they can focus on knowledge building, skill building, and perspectives, social work perspectives in that way. This is more appropriate, and teachers can act as a facilitator there in order to collaborate, how they can do effective collaboration can be ensured there. By actively participating, asking questions, challenging each other's idea, students develop essential skills according to this real world. Therefore, we can see that the critical analysis, critical thinking among the students is very poor. So it will make the students to have critical consciousness in terms of understanding and decision making based on the real world, what type of issues, how to tackle these issues in terms of climate change or in terms of social issues, whatever they're facing in the local and community context. And then reflective approach. The third approach that author was talking, this approach encourages students to critically examine their own experiences, beliefs, and assumptions. So through this reflection is more, it's like a feedback as a tool for a student, especially for those who are doing BSW the level. It allows them to relate with their personal experiences, ideas, what they have studied earlier. With that, they can develop and their historical context and assumptions. Students can participate in introspections, critical thinking, empathy, and personal growth by adopting this numerous reflective activities. So even it helps the students to critically analyze their behavior and belief systems, because in India we have a lot of faith system based system and belief systems. Therefore, it encourages the students to discuss, express their observations, listening their own viewpoints among their own classmates, encouraging critical thinking and empathy. That is what we need for the social workers. And integrative approach. Again, this Chauhan, he was talking about the integrative approach in social work or social sciences method of teaching. Integrative approach, as for we know that NEP 2020 is also more multidisciplinary, integrating different ideas, the discipline, viewpoints to acquire holistic knowledge on social work processes or social processes. Therefore, it makes the students to understand various other disciplines. What is the uniqueness? For example, some people do not know, some of them even they ask, what is the difference between sociology and social work? So it will give an idea of what is the difference between anthropology and then ethnography so political science and public administration. So in that way, it will give a vast knowledge. This method assists students to develop more comprehensive grasp on diverse nature of globalization and recognizing many elements interact and impact one another. So therefore, it will give a lot of gain skills and knowledge and to analyze and synthesize the ideas. This strategy prepares students to real-world difficulties, such addressing complex societal problems, which frequently needs multidisciplinary. So therefore, this particular phenomenon, this particular approach is more interdisciplinary in thinking, critical analysis, and synthesize the knowledge. And the last inquiry-based approach, questioning, inquiry-based approach is questioning type. Why, how? And this approach encourages students to become active investigators. They have to investigate, question, problem solvers, promoting curiosity, critical thinking, greater grasp on social sciences concepts. So with that, the knowledge of students are encouraged, questioned, they do analysis, do research. So for example, in a unit we call causes of poverty, when we talk about social problems. So in that way, this particular way will make why poverty comes, what is the reason, why discrimination, why there is an inequality, why there is no justice, why does this type of disparity, this type of question should be asked. So they will understand these are the factors are contributing for poverty. And so with this, they will promote the skills, because more social work is more on skill, practice, and knowledge. Attitudinal change should also come among them. Therefore, this will make an evidence-based perspective, understanding, decision-making among the students. So these are all some of the strategies, techniques, approaches suggested by Chauhan. And now we come to the last part, assessment framework. So assessment is not an easy thing, again, because it is more sometimes, especially the concepts, social work, discipline, it is more subjective in nature. We have to be more objective. How it could be objective? Sometimes when the students, they come, I have done a lot of work in the field, and I got very less mark. This type of problems are also they are facing. There is no proper assessment framework or model in all across the India, across the state, in terms of social discipline. So therefore, how knowledge assessments could be done objectively. Some criteria has to be developed. And the skill assessment, there should be a set of skills to be needed for a social work. Even when for admission purpose, this type of skills, this type of aptitude the students are having or not, it should be tested. Otherwise, when they come for the field, some dropouts are taking place in these days. And after COVID-19 syndrome, we have a lot of other challenges also, mental health issues also coming up. And there is attitudinal problem, attitudinal change is taking place or not when they go field work. And even assessment could be done more objectively in terms of whether the theory and practices really put it into the field or not. Just like that, they are going and doing like a program-oriented social work. It's not, it's a process-oriented social work. These are all the ways have to be, and values, ethics, social work, whether they are following certain values, ethics, promotion of values, each and every local context, the societal, the community, they have their own value systems. We have to respect their value systems in tune with our social work values. These things should be kept in mind while teaching in the assessment or making an assessment of the students. So therefore, from this particular point of view, this panel discussion, innovation, teaching and learning and assessment, three areas, the elements which is highly discussed, the issues, and then how the issues to be tackled, why these things are taking place, and how the students are to be taught in this particular way, using innovative methods, teaching using technology. And also we have seen some of the strategies or approaches, 5 approaches we have seen, that is with regard to, one is constructive approach, and then we have seen a collaborative approach, integrative approach, inquiry-based approach. So in this way, these particular approaches will be more helpful to the Indian context. And then we have seen some of the assessment aspects, how the students should be assessed. It should be more objective in nature, according to the students' caliber, capacity, knowledge, skill, and practice. So with this, my presentation gets over. Thank you for giving this wonderful opportunity. Thank you, Chair.
Thank you, sir. for that wonderful insights. I hope I'm audible. Yes? Yeah. Yes. So Professor Devendran started his topic by expressing the concern that there are quite number of limitations, but as teachers, but as social work fraternity, we need to face them and we need to see and develop and also come up with evolving strategies to attend to the same. He also briefed about how complex the nature is with respect to different kinds of states in a country like India, and how post COVID students are finding it very difficult to even sit in the classrooms. But social work is still considered as a noble profession, but we have practical challenges in how it's being also viewed as service versus a paid profession. He also dealt with the issues like poverty, migration, globalization, to mention a few. And he addressed the challenge as to how students generally have a dislike for the history and philosophy, and it's challenging to make the classes very interesting. He also mentioned about the need and the evolving changes in terms of artificial intelligence, and also to kindle reflective thinking and communication strategies within the classrooms. His idea of collaborating with other institutions, and how as teachers and social work educators we need to reinvent, and the necessity for having a glossary of terms considering the different kinds of religions and the different kinds of cultural practice we have in a diverse country like India. He also mentions about how social work in a post independence period has changed, and some activities like the collection of pictures of renowned social workers, and also bringing in innovative content based techniques in teaching learning, and how to build shared knowledge through collaborative practices, and also enhance students participation and critical thinking. Inquiry based approach is what he's advocating for strongly, with students as active investigators and creators of knowledge. He concludes by saying that knowledge assessment has to be also done objectively, skills assessment has to be also undertaken, and we need to come with evolving strategies to address the same, and concludes very brilliantly by addressing the mental health concerns and how the attitudinal changes of the students have to be addressed also. So it was pleasure listening to you, sir. And I think we are having two more panelists we will listen to, and probably we'll towards the end have an idea of how all the three are addressing the teaching, learning, history and philosophy. Now we move on to the next panelist. I understand Dr. Grace is not there, so we move ahead with Professor M. Gangabhushan Mohankar. Professor M. Gangabhushan Molenkar is a professor in the Department of Social Work at Assam University, Silchar. Sir holds a PhD in social work from Assam University with research focusing on women in the bricklane industry in Assam. His areas of interest includes labor welfare, women in the unorganized and informal sector, and human rights and advocacy. Professor Moholenkar has extensive experience in research supervision and has authored several books and journal articles on social work and related fields. So, with this, I now invite Professor Gangabhushan to speak on teaching, learning, history, and how macro practice can bring in change in this concept. On to you, sir. I think all the virtual backgrounds and videos have been turned off for better compatibility. So, Professor Gangabhushan.
Yeah, madam, am I audible?
Yes,
Yes, sir.
yes.
Yes. Yes.
Yeah. Namaskar to everyone. I feel very fortunate to see all of you, the same panel. Okay. Uh, I would like to make my presentation with, I will share the screen. Please let me know whether.
Yeah, you can.
Is it visible, madam?
Yes, visible.
Yeah. Oh,
Yes, sir.
respected chairperson, madam, the
Sir, you
president.
have, sir, sorry to interrupt. You have to share your screen. That is not visible.
Go to slideshow mode.
Yeah. Is it okay?
No, sir.
Slideshow.
No, sir.
Now it is visible here, madam.
Okay. Then please proceed, sir.
Then I will make
Ah,
it in the form of Yeah, I think this is okay.
Sir, you please proceed, sir.
Yeah. I will be focusing on most of the things have been covered by Professor Devendranji. So, and he has set the tone for my presentation. So I will skip some of the things that which he has already elaborated. What I would like to focus more on how we can incorporate the concept of macro level social work in social work education. This is what I will give my presentation. We have to understand one thing, like we have been seeing that there is macro level changes have got direct impact at the micro level. So whenever we talk about uh, micro level problems, we have to have an understanding of the connectedness between micro level realities with macro level changes. It can be policy changes, it can be structural changes, it can be because that impact has to be understood from the prism of macro level social work practice. Sometimes the problem in one small village will have an impact because any decision taken at Bretton Woods institutions like World Bank, IFS, these are the Bretton Woods institutions. They have direct implications at the micro level. So this connectedness has to be understood. That's why I started with how we can incorporate a macro social work perspective in our social work education. And we have seen that because of these macro level changes, it has an impetus to changes that has taken place both on the profession, both on social work education, and also on social work practice. So we have seen that we have come up with a lot of like changes. We have seen that there is a transition from liberalism to now we are talking about neoliberalism, the context of globalization. And this liberalization for privatization and globalization has given an impetus to promoting minimum governance, minimum government or minimum governance, or minimum interference of the government. And market has become a whole and sole regulator. So bygone are the days where ideally in a democratic setup, the people should decide the jurisdiction of the state and state should decide the jurisdiction of the market. But whereas in the context of neoliberalism, what is happening is the market is deciding the 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 space of state, and the state is deciding the space for the people. So this is what the major challenge, not only for the democracy as such, but for the professions like social work. The challenge is how we would like to see the profession in the increasing paradigm shift in the of neoliberalism. What exactly we talk in macro social work is, we know that it is very complex, but ultimately macro social work focuses more on with a larger perspective. It's a perspective from every angle, holistic perspective, looking for betterment of the society and for promoting social welfare. This is what from a micro perspective. And what it is talks about is it engages community members in taking personal action. So the individuals are targeted, individual problems are also addressed, but what is important is there must be connections established from that individual to the whole. If a one Dalit is targeted, it's not that empowerment of that Dalit. It's not about just empowerment of two Dalits. It's all about empowerment of the entire Dalit community. So it goes beyond individual, but it also takes into the macro picture of the society. And we have seen that with the resurgence of civil society, social work profession has emerged as very important player. We have to play a very good partnership with this so-called civil society organizations when we are talking about pitching into larger frameworks, when we are talking to understand the problems from a macro and multidimensional perspective. It can be at national level, it can be international level, but connectedness to the grassroots is very pivotal. It empowers, as I said, it empowers and strengthens members individually, but again, support of the entire community as well is also taken into account. Like in for macro social workers, it helps individuals solve social problems and make social change by social and political engagement. Here, the individuals who are at the receiving end of empowerment, they are also acting as a beacon of inspiration for the empowerment of the entire community through their political engagement. So it's not the process which stops at individual level. It promotes the cyclic change from individual to group to community and to the entire society. What is important in this macro social work is we need to make the students aware about macro challenges, and we need to make them aware about the opportunities that are available. So to reflect on diverse sustainable solutions in relation to different social context. Most of the time, students they go with a horse view. They try to understand the problems like a spoon piecemeal kind of approach, where they don't understand the larger picture of the smaller portion. So this is an opportunity for the students. They get macro micro challenges and they also look for sustainable solutions. When they are aware about micro macro linkages, their solutions will be more sustainable. This is what macro social work forges. As I said, the individuals are more politically engaged, and it transcends their immediate life situation and serves to integrate them with the broader community. This is again I am repeating, but this integration is what makes macro social work different from working with only individuals, working with only groups, and working with only communities. So that integration is the lifeline of macro social work perspective that has to be imparted in the entire education process. And this homogeneous comprehensive understanding of the issues, micro macro linkages, it helps the students to understand the scope of inter and intra and transdisciplinary, inter and intra professional collaborations. And the word I use here is a user perspective. There's people who are at the receiving end. I don't want to use them as stakeholder, but the important component of social change. So here the students are to be understood that because the nature of the problem is complex, that complex nature has to be understood by keeping the micro level social realities, context specific social realities, wherein the user perspective plays a significant role. Here the user perspective is the community is at the lowest rung. Even the students who are acting as a change agents are also the users, wherein we need to understand their perspective as well. When it comes to the moral responsibility of social work education, in particular, and higher education in students, what is important is we have to nurture students. We have to nurture students in order to make them more sensitive, more aware about the social issues, and not only that, beyond that, we have to make them politically better informed and responsive to the issues thrown up by the complex and dynamic. I mentioned here Indian reality. To understand this Indian reality with macro level dynamics that plays a significant role in deciding the micro level realities. And here nurturing students is uh, through education in terms of building their perspective. Now information is not a problem. Google is there, internet is there, information is it is abundantly available. What is important here is the students should be properly nurtured in terms of inculcating proper perspective. Here, when I say perspective, is not just a perception. Perspective is like a mirror. It helps the students to understand which side you are, which way you are. Many times, this understanding one's own self in relation to the complex social issues is very, very important. And we also need to be very clear, nurturing students in terms of perspective. It is perspective acts like a glass through which the students see the situation. So personal biasness, personal orientations, personal socialization, everything, becoming, all these things are to be addressed through the teaching, because as rightly stated by Professor Devendra, that we have to understand the context specific culture, diversity, the socialization patterns, cultural hegemony, everything has to be understood. Then only we can build, rebuild, strengthen the perspective that we are thinking is very needed for the social work students as change agents. And this requires very important. We talk about these two things very frequently: theory informing practice and practice informing theory. And this has to be one important component, the lifeline of teaching to be inculcated by the teachers. What way our theory is informing practice, and in what way practice is bringing an impetus towards strengthening our theory. So these interlinkages, these interconnectedness, I don't want to label it bottom up or up down. But that has to be properly linked. And the role of teacher is very important, because teacher baggaged by his experience of field work and baggaged by his experience of perspective makes a lot of difference in bringing this concept of theory informing practice and practice informing theory in the education. And this becomes very critical, very significant on the part of social work. Most of the time, when our students go to the field, they don't understand how exactly. Sometimes they go as they follow a tool-centric approach. Sir asked me to practice group work, community organization, and sometimes in ICGC they say, "Sir, I didn't get any casework. I didn't get any group work." So this is the dilemma. So somewhere down the line, we have to make them understand uh, the nitty-gritties of theory and the nitty-gritties of the practice. So they should be very what you call, they should be nurtured in such a way that they'll be minutely observing their own inner laws, undertones, minutely observing what is happening in the society, minutely engaged in the activities which promote the universal values. So that is what the role of educators as motivator, as inspirator to the students. And this is one of the most challenging part when it comes to integrating theory with the practice and practice with the theory. What exactly we do in education is we would like to make social workers as practitioners. So what exactly? 1 minute. I'm sorry. What our target of social work education is to make social work as practitioners. So what we practitioners require these 4-5 qualities. The qualities is in what way they are going to exhibit resilience under the conditions of complex and high pressure. So in our teaching, in what way we are strengthening their resilience, that has to be taken into account when I am imparting to the students. how we can make our students as better communicators for the service receivers, for the people, we always say, whether our students go as preachers or they go as learners. A very strong popular uh, quotation is there: go to people, live with them, learn from them, start from where they are. So this is what if this is inculcated in them, then they will be communicating not as teachers, not as preachers, but the communication will be making the people to feel as equal partners. So learning from them, and learning by doing and doing by learning. These two things also plays an important role to make them to exhibit their resilience. And whether my teaching, whether our teaching is making them confident enough to prioritize their limited resources. The resources management aspect, not only in terms of physical resources, resources in terms of knowledge. Sometimes we talk about knowledge deficiency, etc. So how they are prioritizing, how they are understanding the available resources, how they are giving priority to the resources that are hidden. So this has to be our goal when we are teaching them the social work. And in what way uh, these three things decide their action taking capacity. And action taking capacity largely depends upon how well they have experience of working with people, how they have exhibited their resilience, how they have better understood the resources, how they have better prioritized the available resources. So action again is a learning process which makes them to understand the importance of again learning by doing and doing by learning. And we always look social workers because the professional traits and they should be acting as the professionals. If that is the case, they have to be very clear about ethical and legal guidelines. That is while working with the people who are vulnerable. Most of the time, when the social workers are working with the people, there is unequal and unequal power relationship is always seen. So here comes the role of social work trainee to understand, social work practitioner to understand how to address the ethical dilemmas, how to address the legal obligations. Second thing is in what way they can engage in reflective practice. Again, this is reflective practice. Practice is more of learning from their own experiences. It's an experiential learning. Again, this theory give impetus to practice, practice give impetus to theory. When we say if that is properly integrated, then reflective practice is very vehemently seen. This is again important. Learning from and teaching others social. This is very important. We are sailing in the same boat. We, being the social workers, how often this is a very important initiative of ISPSW. This kind of conferences, workshops, seminars will give larger impetus to mutual learning from each other. So then this will help us to learn to do effectively, learn to work, and that will decide in what way we are contributing. We are contributing not only to the society, but as a profession, as a discipline. In what way? Again, bringing back the linkages between theory and practice should be our aim. The students should not just go to generate a learning, but the learning should be uh, churned into theory, and theory should also be tested, cross-tested. Instead of following blindly, we should bring in that checking and cross-checking. And as I said, ethical protecting what we are protecting, what we are safeguarding the people's services. So though we service the word, I don't want to subscribe much, but protecting the values, protecting the cultural ethos, protecting, safeguarding the uh, understanding about themselves, community, society, nature, etc. In what way we are understanding their sentiments is equally important. And in the entire process, uh, this this will make us to understand the quality of their care and support. And if we follow all those things like ethical guidelines, ethical dilemma, properly reflective practices, learning from them, all those things, will decide the quality of our care, quality of our support. And in the entire process, whether the social work trainees are in a position to empowering the people to be independent. That is what we say that social work. We say that so enhancing the social functioning of individuals, groups, and communities. Are we enhancing the social functioning of the people? Are we enhancing them to a stage of empowerment? That is what we have to be very sure while engaged in any kind of teaching to the social work trainees. This again, as we have to see our students as tomorrow social scientists, that implies like whether they understand, apply the relevant principles, methods, and knowledge of social work. Most of the time, this is what they experience, which principle. Sometimes the students come, sir, I used first this principle, then this principle. So sometimes they see the use of principles in a linear way. So, but what is important is understanding the linkages between different principles, understanding the knowledge base of social work with other like-minded and professions is equally important, because we are not the one who is doing. We have to understand, because our knowledge we have derived from sociology, anthropology, and behavioral science. We have to understand those nitty-gritties. And in the entire process, as social scientists, my students should be able to bring in evidence-based practice. And this evidence-based practice is comes through effective teaching, effective learning process. And as we know that the entire educational process, what we do is we impart how such knowledge, how such skills, how such competences are inculcated in the teaching learning process, so that they are equipped with the requisite knowledge, skills, strength to bring out evidence in their learning and social work process. What exactly we look for here is most of the time we have to move away too much of service. As Professor Devendran sir also mentioned it. They are not there to as service providers. What is important is to promote change, a larger change, sustainable change. And that sustainable change happens only when we gradually shift from focusing only on institution to non-institution. Institution like these days, we have to have connections between macro, as I said. For example, if the students are asked to go and understand the Panchayat Raj institutions, so they should also be aware about in what way this functioning of Panchayat Raj institutions have direct bearing with sustainable development. How the linkage of healthcare services is with WHO's mandates. So this institutional and non-institutional programs has to go hand in hand. From remedial to those that confront the cause of the poverty. I mentioned poverty, but not only poverty, but here I would like to mention even attitudinal change. So bringing attitudinal change among the people, among the service providers, plays a significant role, because for any larger we have a plethora of programs, plethora of policies. For every problem we have legislations. What is important is we have uh, no programs for bringing attitudinal change. So we have to shift from remedial to bring out attitudinal change. We have to focus from shift from private concern to public issues, because ultimately the issues of public issues will again affect the individuals. That's why the beginning of my presentation I told that connectivity between person to public person to society has to be understood. Here, research should not be. Most of our social work research, even if you see typically, our research is predominantly in the allied areas. How much, how many education institutions have produced research properly on understanding how effective our tools are there, how effective our methods are there, how effective our skills that we use while working with communities. So, what is important from social work point of view is to research should bring in those synchronization uh, of results from various allied researches, and again specific research has to be conducted focusing on uh, how effectively our social work methods, how effectively, that's why there comes the role of indigenous knowledge, how to bring in the existing ethos, the existing value system that are there. So research has to understand the effectiveness and efficiency of these tools that we use in social work. This is what, in order to move ahead, we need to promote practice relevant knowledge. Practice relevant knowledge, like every knowledge has to be implementable. And we should know in what context this relevant knowledge is derived from. In what context this knowledge of using tools, techniques, methods is effective. So that is practice relevant knowledge. We have to focus more on that. When we talk about understanding students about macro social work, here practical exposure has to be given to the trainees or students on academic activism through critical research. Critical research is not criticizing anything. Critical research is come up with constructive criticism, come up with most of the time, whether a research or whether you're a teacher or
Sir,
researcher.
sorry to interrupt.
Madam.
Sir, sorry to interrupt. You're almost concluding, sir.
Oh, madam. Oh, yes. Sorry.
Yes. Okay. Okay.
So what is important is how we are focusing on our in-depth knowledge of connecting macro level policies to micro level realities. And in the entire process, we should take care of flexible learning also, because many times we should not be rigid of going to the field to work on. There has to be flexibility in learning. Let the student have freedom to express. Let the student should have freedom to express, freedom to think beyond. That's why out of box thinking. As you know, there are many things has been already told. What I focus is on this experiential learning only makes students to think that they are exposed to the real knowledge, and what is important is through our storytelling, role play, whatever. Can we make students think out of the box? Yesterday, I have met very good storyteller from Bangalore. I have seen the session just by narration. These days, the students lost the tendency of talking because family time. At family also, people are not there to listen to their parents, not there to listen to the friends. Both of all of them are busy in their mobile. So storytelling itself is an empowering process wherein they comes up. And I have seen that at the end of the session, 7 days session of storytelling and all other things, students have busted with emotions. They started crying also, because storytelling is not just about telling something. The undertones, the emotions also comes out. It's not news reading, it's a storytelling where your emotions are also there, empathy is also there, role play is also there, role reversal is also there. So role reversal many times understand the other's point of view, all those things, So we have to come up with those things. Continuous update of knowledge we have derived from sociology, psychology, etc. So this should be a continuous process. Good social work practices have to be recognized and acknowledged. We have very good examples of community development programs. I'm very happy to share like one Swadhyaya moment in Thane district, wherein more than 200 decades they have surrendered and they have become, I don't want to use the word civilized, but it has got a lot of implications on the behavior of the people. So we have very good, so recognize and acknowledge the indigenous interventions which are there. So exposure to unstructured setting is also very important. We need to go beyond the institution. Interface with the development sector is equally important. Whether we are there to address the needs of the development sector, I think social work education institutions should influence the development sector. Whereas when our students go, they get succumbed to the needs and requirements of the development sector agencies. What is important is we have to have that contributory significance for the development sector. Research, how is our research is going to address the policy change? Most of our research gets into library, so we have to really think about that. And our research should promote to practice relevant knowledge. This is mutuality and reciprocity with the communities. There is in Karnataka some they made it mandatory that once if I am studying on any tribe or whomsoever, my first responsibility is to go and discuss the brief findings of my thesis in front of the community. Then only after getting approval from the community, then only I'll be able to submit it to the university for the award of PhD. That is wonderful notion. So in what way we treat communities as knowledge production partners? That is very important. This last but not least is uh, we should go beyond focusing on micro level research. Need to go and talk about macro level thing, and there is a need to bridge between micro level activism with macro level policy change. For the entire process, our mission is to prepare our students for holistic learning strategies and holistic perspective, and effective collaboration and with like-minded professions plays a significant role for promoting effective teaching learning method. Thank you very much, madam, for giving me
Thank
this
you. Thank
opportunity.
you. Yes, sir.
Thanks to the organizers. Thank you.
Thank you, sir. Thank you so much. I had to intervene requesting you to conclude because we have one more speaker.
Yeah, I
So
know, man.
apologies for that. Yeah.
Yes.
So, sir, Professor Gangabhushan has addressed how macro practice has to be seen from a larger perspective so that there is a betterment of society and also engages, the active participation of the community members. Also, he stresses about how students need to be aware of macro challenges and practices and also how to understand the larger picture of a smaller problem, how critical thinking and reflective thinking is necessary. And he also emphasizes on the concept of integration, which is a macro practice of entire education practice. He also spoke about the scope of intra-professional collaborations and the need for having micro-level contextual perspectives and how they need to be put in place. Sir also emphasizes on how nurturing students is very, very necessary to understand and take the essence of social work education knowledge to practice. He also spoke about the complex, the dynamic issues, the realities which needs to be understood, and through education perspectives, how social work knowledge and education can be built. And he reiterates the importance of theories and how it needs to be linked with practice and how teacher plays a very crucial role. In fact, he or she is the lifeline, and he gave an example of about ICTC center also, and how the social workers have to be very, very careful about the theoretical and the practice mode, and also about the concept of people and unequal power relationships. He also appreciated the role of the ISPSW for organizing such a conference so that there is more of mutual learning and how people come together for learning effectively, thereby emphasizing the need to propagate institutional and non-institutional linkages and give the example of Panchayati Raj institutes. He underlines the necessity for an attitude change and how it needs to be brought through skill-based programs like what he spoke about, skill building, storytelling, and all that. And he concludes by saying how continuous updation of knowledge is very, very necessary for all of us to work together and to take the lessons learned from this forward. Thank you very much, sir. It was indeed interesting to hear. However, due to time limitations, we'll now move ahead to the next and the last panelist of this session, Dr. Ratna Hiram. Madam is an associate professor in the Department of Social Work, Assam University. She has completed her PhD from Pune University in the year 2008. She is currently holding the post of associate professor in the department. Her areas of interest are social movements, identity and ethnicity, gender studies, peace and conflict studies, rights-based approach, and healthcare practice. So we are very happy to have amidst us another speaker from the Department of Social Work, Assam University. Madam, we request you to speak on teaching, learning, social science perspectives. It will be really interesting to hear how this needs to be maneuvered within our students for advancement of social work knowledge and practice. On to you, Dr. Ratna. Madam, can you hear me? Dr. Ratna, can you hear me?
Ratna?
I think she has some technique.
Ratna, please.
Should I call her?
Yes, sir. Yes, sir. All of them have to mute their mics and also the videos go muted. I think because the organizers are having some practical problems there.
She is here. I think she had
Yes.
some technical issues because she is in the panel.
Okay. Okay, sir. Thank you. Yes, Dr. Ratna, you can take over. So we're almost close to the time, so you'll get around 10 minutes and then, we do the concluding remarks and conclude it.
Please go ahead.
Am I audible now? I hope I'm audible now.
Yes, madam. Yes, yes, please go ahead.
What about the screen?
Madam, they are switching it on.
Yes, screen. You have to go for this slideshow mode.
Yeah, I'm doing that.
Sometimes connectivity have an issue with screen presentation.
Yeah, just as it was my turn, my network started disturbing me.
Ma'am, you just switch off your video, that will help.
But is my screen visible to you?
Yes, your screen is visible. It's not moving although, but your first slide we can see.
Okay, let me see this.
Yes, meanwhile, Dr. Ratna is fighting with her connection. I would like to inform to the paper presenters for the free paper session 6. Please be here After this session, we are going to having our free paper session on this platform only.
Never mind. I'm not able to share the screen, the slide. I prefer to at least have the video on. Is that okay?
I think the organizers switched off the video. Ma'am, you can start, ma'am. Let them do it. You just unmute and start speaking.
A hearty good afternoon. I have lost a few minutes there
presentation
because
also
of...
you just stop once your presentation, stop presenting and represent again. It will move.
Stop it and do again?
Yes. Now share again. Yes, it is visible.
Okay. So I hope this will work. Yeah. So
Yes,
the
slides
topic,
are also moving.
before I get to the topic, I would like to extend my hearty thanks to Professor Kanagaraj, who I really admire, and extremely grateful to have given me this wonderful opportunity to be amongst you all, my fellow panelists, as well as each and every member that are gathered today online. And the topic that has been assigned to me is Teaching, Learning, Social Science Perspectives. What I would like to state here at the very outset is that my predecessors who spoke before me, I felt as I was listening very intently to them, probably because of the title that was assigned to each of us, the teaching learning phrase that is there, probably holding on to that. A lot of classroom kind of student teacher modality kind of thing was presented, but I prefer to adopt a more what should I say, a pluralistic and a holistic approach. I want to move out of the box of classroom and learners only as students, because we ourselves, each one of us is a learner today, and we learn from varied and multiple social realities in the lived world as we exist today. So my approach towards my presentation perhaps would be a little different from what has happened before me. I have designed the structure of my talk today as I begin with social work as a discipline and its gradual epistemological evolution. Next, I would move on to the disciplines or the perspectives or the theories it draws from. This I will be doing very briefly because time is very limited. And I will also emphasize upon how social work is a unique field of practice. And again, here I would like to reiterate that both my preceding speakers have emphasized upon the increased need for research in their own ways, in their own language. I remember that they have focused upon it, and so do I, because there is no escape from research if we are to authenticate our practice and our profession. I will also dwell upon the intersectionality of socioeconomic dimensions, focusing more upon gender and ethnicity. These are my core interest areas. And ethnicity is also very close to me. Gender, of course, being a woman. And ethnicity is also very close to my heart because I hail from Manipur. And we all know that the Northeast is composed of varied ethnicities, and which again, when we place it, when we juxtapose it with the mainland, we are somewhere on the margins. So I will also be talking or citing some instances of how these interact and place certain situations upon us in terms of social mobility, attainment of education, women's education, and access to the labor market. I will also talk about the social politics of social work, namely brought on by globalization and also the resultant feminization of social problems, and how today we are moving towards an epistemological turn and a linguistic turn, and therefore why a multidimensional and multicultural perspective building is necessary with the help of the social sciences, because those are the very fulcrum on which social work exists. Sorry. Now, beginning with social work as a discipline, it may be regarded as a product, as we all know, of the Enlightenment. We all know about it. or product of the Enlightenment had been an ontological shift from a religious approach to a secular one. And we are still struggling to find a firm foothold as an academic discipline when we compare ourselves with, say, sociology or political science or economics. So historically, we have experienced a gap between research and practice, as we have been heavily borrowing from these other social sciences, and we lacked our own scientific foundation. So today, as we move ahead, there is a new thrust on linking social welfare and social policy. The evolving thrust, therefore, in the past few decades that has been observed, it has been emphasizing the need for scientific development within social work, which of course, again, emphasizes upon the need for research. And this is strengthened, its relation to research and the social sciences. And social work research is moving in directions that indicate an epistemological turn based on the understanding of knowledge production. And as I said earlier, while I was laying out the structure, there is also a linguistic turn which enhances the meanings of different life worlds and worldviews. As I move ahead, I will certainly be elaborating more upon it. And we strongly advocate an egalitarian world and social justice, which always has been the core of social work, because, you know, social justice is something that we all espouse in our profession. And the varieties of disciplines or perspectives or theories that it draws from are many, many. And teaching or learning the discipline of social work is certainly not only about social work alone. It is about politics, it is about psychology, it is about sociology, economics, and so on and so forth. So to some extent, we could describe social work as an eclectic field where we draw upon all these and it operationalizes itself within the social milieu where we all exist. So one important feature is that it is often about changing and altering society, and individuals and groups. We would like to understand individuals and groups and how they change their ways of living or behavior intentionally. Why I say intentionally? Because social work is that profession or that particular practice wherein we move in to intervene and make people realize their own capabilities. Hence, I use the word changing their behavior intentionally. So this concept of social change and operationalizing it in the political and social context, this marked the birth of a new and modern social work. So therefore, the epistemology follows the ontological change from pre-modern to modern societies. Some influential theories that I just quickly picked, and I will just skip through them because elaborating will take a lot of time. Psychosocial theory, we know that when social work began, a lot of this psychoanalytical theories, psychodynamic theories, all these served as the very basis wherein casework was itself built upon these. And then we also have attachment theory, behavioral theory, CBT, empowerment theory, systems theory, conflict theory, contingency theory, grounded theory, social exchange theory, etc. So these are the few theories, and definitely they are not the end all, but just those that I felt I could list, I have listed here. Social work is definitely a very unique field of practice because we aim for a new kind of practice where good actions and good results can be demonstrated and recorded. But certainly we don't say that it is the final outcome because it is always a dynamic process. We don't say that we have come to the end of the tunnel. We continue to move towards and find new pathways. Because as we know, new social realities and new social problems continue to emerge, and the social reality I talk about in the world that I live in is practically going to be very different from the social reality that people who inhabit different geographies or people who belong to different cultures, different linguistic backgrounds, they are also going to experience different set of social realities. So there is no end to the process of knowledge making, and it reflects a distinct mindset, a thirst for knowledge. Social work has a strong belief in the human capacity for personal transformation and in the ability of society to improve the opportunities required to do so. It relates to ideology as well as to scientific progress and developing insights, multiple insights into society. And also it has to relate to science and research and certainly to public policy. Now, I would like to emphasize that there is a need for strong trust on social work research. In academics, social work may be regarded as a socially concerned subject that somehow happened to, or we intended to make it depart from sociology and psychology so that we could carve our own niche and we can form a new distinct field of our own, focusing on the applied science of social and psychological knowledge. Many of the studies, it looks into social phenomena and social problem, but not at how social work is practiced. So these are the shortcomings of our studies also. We tend to kind of get mixed up with sociological studies, etc. So here is where we need to really hammer ourselves and look into the intricacies of social work practice. So the catch here is that many times it may have to do with the funding of research. Where are we getting funds? What are the topics that are researchable? So this again relates to the power structure of the academic world and the social sciences and of course the political climate that we live in. Research is needed to underpin knowledge. It grants legitimacy to the profession and its practice, and hence acceptance and public confidence about the intervention. This is why I insisted that I build up upon the points made by my predecessors, that research is very vital, it is very essential, and the findings of research, when we record research, it grants legitimacy to our profession, and obviously public confidence will be built and acceptance about how we would intervene into multiple social problems. We work with individuals, groups, communities. We advocate policy change. We work in different fields of practice, whether with children, whether with people with mental instability, mental issues, or in different agency settings. So a growing number of, one point that I would like to highlight is there has been a growing number of research units. So this is definitely a good sign. We appreciate and accept it, that it is essential, that there should be a burgeoning of research units, and it pinpoints to the value of how research is being evaluated. But the catch is that it is uncertain about the determinants of the priorities and the focus of research, because many times social politics becomes predominant, and what priorities are being determined and how those findings are being interpreted is also very important. Nonetheless, for standards of practice to be maintained and improved, there is an indispensable need to extend knowledge through research. Some practice-based concerns I have listed. Informal care and care by voluntary organizations. This outweighs the publicly funded services. In this context, I would like to cite the example of what is happening in Manipur now. Many people may, in fact, it really perplexes me, and I'm thoroughly confused as to what should be my answer when people ask me whether Manipur is all right now, because certainly it is not all right. And I doubt that it could become all right for many, many years, considering the ethnic violence that rocked Manipur more than a year ago on May 3 last year. Pretty little has been done about it. The media prefers to look the other way because in this also politics is involved, and perhaps the creation of the problem itself is so politicized that the solution itself needs a very strong political will to douse the flames that is certainly still burning. So in this context, what I would like to say is that there are still a lot of these shelter homes, or what should I call them, relief homes, where the Meitei population the majority ethnic group in Manipur, who reside more in the valley areas, and the Kuki ethnic group, who reside more in the hills. Each one have not been able to see eye to eye in the as a backlash of the recent ethnic violence. So in this very disturbing scenario, the public organizations or the government funded services have almost failed to do much as opposed to informal care by conscious citizens or by voluntary organizations who have done quite a lot in terms of relief to these people. Another problem related to practice is that there has been an increasing number of elderly people or aging people across the world, I would say, and particularly so in India. And it is an increasing social problem. And as per the statistics that I managed to gather, in 2023, aging in India, the problem is so serious that in 3 decades from now, 1 in every 5th Indian will be a senior citizen, according to the United Nations Population Fund Agency. So it is a very strong or disturbing, or at least a very thought-provoking statistic, I should say, for which we have to start arming ourselves now, because the elderly are prone to multiple health issues and ailments, which there has been a term that has been used, namely bed blocking, as in they are moved into hospices or hospitals or even old age homes where they continue to live, because longevity, as we know, is increasing today in the wake of certain advancements in science, as well as multiple other genetical evolutions. And so bed blocking is one thing that we would like to deal with, and it is looked at as an unwelcome burden on the rest of society. So the burden of old age, once again, as I said, it also unfortunately bears more heavily on women. We also have statistics which show that many times the women outlive the men. The longevity of women are much more, and many times again, we also know that women are dependent upon men for their income. So probably the widow pension is not sufficient. Probably she is not given access to the widow pension. Probably she has nothing to turn on to. So what happens to such elderly women? So these are really thought-provoking questions that we in social work must think of. And research in these areas would certainly help shape public policy, because to be prepared for the worst is always the best way to take on any kind of problems. Now I come to social mobility. When I talk about social mobility, we can talk about how education can be one factor, or income and occupation. We in the social sciences know very well that these are very important parameters or variables that are inescapable, unavoidable, inevitable when we do our research, because they determine our socioeconomic status. And without understanding the socioeconomic status, which provides the baseline data, we cannot move on to any kind of research. Now, how do these variables determine social mobility? How it interacts with gender and ethnicity? I'll be dealing a bit with them. Now, when we look at student trajectories, the participation and achievement in schools somehow do not necessarily translate into higher education and successful employment, specifically for women and specific ethnic groups. The point I'm trying to make here is that student trajectories, the growth in their performances and their active participation in the schools, many times are not necessarily resulting in the fact that they are continuing to show the same kind of trajectory of growth when they move on to higher education, nor when they try to enter the labor market. So there is a gap between what you achieved as in terms of education and what is your final socioeconomic attainment. So when our socioeconomic backgrounds are influenced or impacted by various other multiple factors, definitely our life chances in the labor market are affected. And participation in the labor market can be influenced by culture.
Sorry to intervene. Can you please wind up in 2 minutes?
Yeah. But I started after 12:30 and I have noticed that everybody got more than 30 minutes.
We've been almost telling them. So you can also take another 2-3 minutes because organizers are asking me almost. Please proceed, madam. Proceed.
But this is a little unfair to me. Because I have still a lot to say.
And that's okay, but you can wind up like around within 5 minutes, madam. Continue.
Okay. So it impacts life chances in the labor market, and participation in the labor market is certainly influenced by culture, family, individual expectations, geography, and direct and indirect discrimination. Since you say that I have very less time, I will jump a few things. So social mobility, ethnicity, and education. I have highlighted these few things like listening, the listening span, the attention, the listening ability, the attention span, understanding, speaking, reading, writing, all these are going to be affected. Problem solving, reasoning, numeracy, language for communication and thinking, linking sounds and letters, all these will determine social mobility. So hence I emphasize, and we need to look beyond just education and address other factors or other barriers that are faced by ethnic groups and by women specifically. So what I highlight is that simply attending university is not sufficient for social mobility. The subject choice also determines or plays a very vital role, whether we opt for the sciences or the arts, and gender and ethnic norms influence subject choice and hence social mobility. Urgent action is needed beyond education across all sectors of the labor market and society to address the barriers that young people face when they try to seek entry into the labor market. And it is very important that many of the groups that either attain the highest or are improving their achievement in the fastest way, many times it is observed that they are not yet able to translate educational success into labor market outcomes. And this is something that has been particularly noticed as a very specific issue among ethnic groups and women. And a range of reasons has been identified for it with regard to participation in the labor market. As I specified, it would be culture, family, individual expectations, geography, and direct and indirect discrimination. So when I talk about geography, we can talk about a very specific example comes to my mind. We talk about digitalization in today's world. Particularly, we all saw it during the COVID scenario. Right now, also as we speak, we are doing things online. And the geographies that people hail from. I just went on a trip to Arunachal Pradesh and I was not able to connect to anybody for 3 days. And that was something that gave me a very life-changing experience because we take our connectivity for granted. Neither was I able to make calls. Here and there in some specific spots, I would be able to connect, but internet was completely off the grid. So these are things that so in this kind of a scenario, how do people attain social mobility? How does one gain higher education? Or for that instance, how does one enter the education system? Now, female underperformance in STEM subjects. These are very burning issues that we must discuss. The presence or the absence of women in science, technology, engineering, and mathematics as subjects. In recent years, the girls' outperformance of boys in examinations has frequently been highlighted, with girls more likely to participate in higher education and more likely to achieve higher grades. They are participating, their grades are also very high, but this pattern is broken when it comes to maths and in STEM subjects. So females and males now somehow perform similarly in STEM subjects, but girls are less likely to take up these subjects as they move ahead. Now, another statistics that I would like to share here is, according to the All India Survey on Higher Education, enrollment in graduation, post-graduation, and at the PhD level, this is about India, and about girls' enrollment or female enrollment in STEM subjects. The number of females rose from 38.4% in 2014-15 to 42.6%. So this is quite high, but the sad part is this does not necessarily translate into their gainful entry into the job market. So where do they disappear and why do they disappear are certainly very thought-provoking, and we must try to channelize our research interest in such areas. There are differences in social mobility where family factors also influence attainment gaps in future social mobility. And I would like to move to certain things around the end because of paucity of time. I spoke about the labor market segregation and the interaction between geographical mobility, local labor markets, and social mobility. And the one point I would like to emphasize or highlight here is about ethnic economies. What are these ethnic economies? Here again, I would like to give an example. When we look at the industries, the service industries, hospitality sector in the mainland, the so-called mainland in India, we see a lot of people belonging to the Northeast engage in these sectors. Now, these are what we would refer in India as ethnic economies. Otherwise, when we go out of India, we do know about many people, the Punjabis and the Sardars migrating out to Canada and then pulling on to more of people belonging to their ethnicity. So these are what we label as ethnic economies. So coming back to the Northeast ethnic community and creating their own ethnic economies in the mainland, these plus points in the sense that they are called upon or they are helped to move out from inaccessibility to job opportunities because of conflict-ridden nature of the geographies from where they hail from, lack of development, lack of employment opportunities, or underemployment, or rather not to be seen in a disguised employment kind of thing. So people move out. So those are the plus points where they seek some kind of employment opportunity. But the negative part of this is that many people tend to get stereotyped and tend to get sucked into such what should I say, boxed in kind of opportunities or job markets, which perhaps may not always be the best options. Then now I come to this epistemological term, which I spoke about in the beginning. During the 1970s and the 80s, a change occurred in the focus of research and the idea of what science as
Ma'am, your voice is breaking.
As knowledge was.
Can you go ahead with the concluding remarks, madam?
So we moved from positivism, which was dominant around that time, and it almost had to take on a kind of a defensive position.
I'm unable to hear her.
About that.
Madam, I think you've lost your connection. Hello, Dr. Ratna?
Ma'am, she is not in the panel list. That means she lost the connection.
Okay.
And we are disconnected.
Conclude,
Yes.
ma'am. Time is up.
Okay, sir. So I think we've almost lost our connection anyhow. I think I'll just consolidate her major opinions and her views in terms of, teaching, learning, social science perspectives. So she's appreciated how the panelists have actually given their own insights. And she says that in terms of gender and ethnicity, she also has her own views. She's thrusted upon how social welfare and social policy needs to be interconnected and how it's evolving now, and how at the end of the profession, social justice is what which is very, very primitive, and it's playing a very pivotal role as far as social work provision is concerned, and also how social work has been considered as an eclectic field which takes into consideration all the social sciences like psychology, sociology, and other social sciences as well, and how the societies have been changing and altering. She also played a very crucial role in emphasizing how different theories are there and how the interconnect to social work practice is very, very essential. And she also highlighted how funding for research is very important and how social work is trying to create a niche apart from other social sciences, and how we don't see only problems as problems, but interventions are also very, very necessary. She made a mention of the Manipur ethnic violence and the role of the media, the political will, and also about the politics behind it, and also about the relief camps and how people from the same communities now, either it is cookies or the Maitis, how now they have to live together, and what kind of experiences they going to have. And she emphasized and concluded also about stressing the fact that every fifth person in India is supposedly going to be an elderly, and how the elderly population is increasing, which can be an increasing social problem, and also about the kind of social mobility and the problems, the practical problems of digitalization when she personally encountered experience in Arunachal, and also about a very pivotal step which needs to be thought about here, how the performance of boys and girls, I mean both genders, and specifically about the participation in the STEM courses as well. And then probably we just lost a connection. We understand the practical difficulties in terms of time management, but I think we had a lot of time, especially because we did not have Dr. Grace. Otherwise I would have restricted too much, but anyhow I understand that you wanted to say some more, but you couldn't conclude. We understand, but it was a wonderful experience. I think having all the panelists, I really appreciate Professor Kanagaraj Ishwaran, President of ISPSW, for conceptualize this very effective and a very fruitful panel discussion. I think, whether it is offline or online, we teachers, once we begin, then, our passion never goes down, because our thoughts, our sharing experiences, as rightly put by all the panelists, we always want to take the opportunity when it comes. And I think, as rightly pointed out by Dr. Ratna, social work teachers and educators, we always want to create a niche as far when compared to the other social science, disciplines. So in that way, thank you, sir, for giving me this opportunity. I also thank Professor Gangabhushan, Dr. Ratna, and also Professor Devendran, who started, the panel discussion, and who also happens to be the head of the department, and also I think all the panelists, somewhere one after the other, almost, you coordinated very well, beginning from Professor Devendran, who spoke about history, philosophy, and then Professor Gangabhushan, who spoke about the macro, and Dr. Ratna, who spoke about social science perspectives. I also had the august presence of Dr. Sunil Prasad, who served as the rapporteur, who also has received many accolades, and is also an assistant professor at the Nerine. His presence has really mattered. And thanks to Mr. Bhupendra also, who coordinated the technical session here. I think the Department of Social Work, Mizoram University, and ISPSW are making strides in terms of, disseminating social work education, as rightly put by all the panelists, from Professor Devendran to Professor Gangabhushan and to Dr. Ratna, that we are here to share, to actually help each other and support each other. And with these few words I end, and I thank the panelists, I thank the organizer, and thanks one and all for actually being together on a Saturday. But still, our spirit and enthusiasm, even an inch is not less as the weekdays. Thank you very much, and hope to look forward to associate with all of you in the near future. Thank you. Thank you so much.
Thank you, madam. Thank you, Professor Gangabhushan, Professor Devendran, Professor Ratna, all of you. Thank you very much. Sorry, we could not give more time. We will explore opportunities for giving greater space. Okay, thank you, one and all. Dr. Bhupendra, sorry that it was delayed. So interesting, so engrossing, no something. Thank you, thank you. Please bear with us.
Yes,
Thank you. Thank you to
so
everyone.
much, everybody.
Thank you. Thank you.
Thank you, all panelists and the chairperson. And I think that we must have devoted at least 2.5 hours for this panel discussion. Then it would be okay. So it was our mistake that we given a lesser time. But again, we have to conclude several things within these 3 days. So we have our own limitations. Despite these limitations, you contributed significantly and very beautifully. Thank you so much to all the panelists, Kanagraj sir, chairperson ma'am, and everyone. So now we are moving to our next session. Thank you all. Dr. Manjurana and Dr. Mool Raj would be chairing this session. Mool Raj sir, please allow me to promote you as a panelist. Or you can raise your hand so that I can promote that link. I think I can see your name twice. So that making me confused. There might be another person with same name. Dr. Moolraj. No, please accept my request to be promoted as panelist. You are declining my request. So, okay, all the presenters, I also would like to request, just raise your hand so that I can promote you.
Hello, sir.
Moshmi, are you here? Okay, follow me. Sorry. Dr. Moolraj. Any other presentee in the attendees list?
Hello.
Sorry if I'm pronouncing someone's name with inappropriate way. Just forgive me. Rigzen, Chanchal, Alisha, Isita, Nistha, and Paulmi. We have 6 expected presentations in this session.
Yes, sir. My name is Chanchal Kushwaha.
Sorry.
My name is Chanchal Kushwaha. Challenges faced by the person with mental illness in rehabilitation topic.
No, need not to introduce yourself. I'm just trying to conclude that whether all the presentees are here or not. I'm just trying to inform if anyone from the presentation or the list of the presentees is remain in the attendees list. Please raise your hand so that I can bring you in the panelist list. Only panelists can share their paper PPTs and they can speak with their without any difficulty.
Okay, sir.
Okay. So without making any delay, I think Dr. Moolraj is having some difficulty to accepting it. So he will join me in between. I would like to introduce our chairperson of the today's session, Dr. Manjurana. Dr. Manjurana is consultant psychiatric social worker working in the Department of Psychiatric Social Work at Institute of Mental Health under the University of Health, Pandit B.D. Sharma University of Health Sciences, Rohtak, Haryana. And she is one of my colleague. And Madam would be the chairperson for this session. Madam, over to you. We have 6 sessions, and as Paulmi was supposed to present in the award paper category, but due to some issues, it was not being able to present in the award category. So I would request you allow her to present first, and rest the list is with you. So Paulmi, Dr. Manju, over to you.
Thank you, Dr. Bhupen. I'm extremely grateful for being together a part of conference. Thank you so much. Paulmi, please start the session.
Good afternoon, House. I am Paulmi Mukherjee, MPhil scholar, presently pursuing the MPhil from Psychiatric Social Work Department, CIP Ranchi. Sir, can you please share my PPT?
You can use from your end, Paulmi. It is open. You can share your PPTs from your end.
Okay, sir.
Every panelist can share.
My presentation is psychosocial factors in substance-induced psychosis is case study from Eastern India. My co-authors are Dr. Narendra Kumar Singh and Dr. PhD. He is currently working as a senior psychiatric social welfare officer, Department of Ispsw, CIP Ranchi. And another co-author is Dr. Vednes Mehta. He is a PhD, emergency psych professor, Department of Psychiatry, CIP. Substance is a physical material with a particular or definite chemical distribution deemed harmful and usually subject to legal restriction as defined in Merriam-Webster Dictionary. Substance abuse refers to the harmful or hazardous use of psychoactive substances, including alcohol and illicit drug as defined by WHO. Substance-induced psychosis is a cluster of psychotic phenomena that occurs during or immediately after psychoactive substance use. They are characterized by hallucination, misidentification, delusions, and or ideas of reference, psychomotor disturbances, and abnormal affects, which may range from intense fear to ecstasy, as defined in ICD-10. Aim of the study is to portray the psychosocial factors contributing to substance-induced psychosis. Methodology. This is a case study and studied in the inpatient department of the Central Institute of Psychiatry, Ranchi, during September 2023. Case record files and social demographic variables were reviewed. Psychosocial assessment and management were done with a selected case. Case conceptualization. index patient, Mr. NK is a 27 years of age, Hindu, unmarried male, studied up to class 8, hailing from the low socioeconomic background of Chhatra district of rural Bihar, was admitted to CIP, which is consists of intake of cannabis and alcohol for past 6 months, muttering and smiling to self, with dream tendencies, aggressive abusive language, and assaultive behavior, and decreased sleep for past 4 years. Diagnosed with mental and behavioral disorder due to use of alcohol, harmful use, 18.1 as per ICD-10, mental and behavioral disorder due to cannabinoids, currently using the substance, active dependence, F12.24 as per ICD-10, and schizophrenia unspecified, F20.9 as per ICD-10. A psychosocial assessment reveals that the patient belongs to an extended family consisting of 5 members. In personal history, it was found that the patient's mother died by heart attack in 2008. It was a sudden death. The family was not ready for the loss at the time. The patient was 12 years of age. He studied till class 8 and then he left school as there was poverty in the family and he wanted to earn money and contribute to the family. Occupational history reveals that the patient has been working as a truck helper since the age of 15 years in 2011. He worked for 7 years and gradually started taking substances with his peers. He has not worked for past 5 years since 2018. He used to be in a long journey truck drivers and he visit various places. He used to earn 7,000 to 8,000 rupees per month, on which he used to keep 1,000 to 2,000 rupees with him, and the rest money he used to give to his father for family expenses. Family dynamics reveals that the family's internal boundary is open and external boundary is diffused. Couple subsystem between between patient's brother and his sister-in-law is formed and functioning inadequately. The paternal subsystem between patient's father and him is formed and functioning inadequately. The sibling system is formed but functioning inadequately. Family is in life cycle stage A, aging family members, retirement to death of both spouses as per 1977. The nominal head is the father and the functional head is the elder brother. Democratic decision-making pattern is present in the family. The elder brother and father, being earning members of the family, take care of the family. The elder brother and father, being earning members of the family, take care of the family. They perform their roles as leaders of the family by taking care of the materialistic needs of the family. The patient sister-in-law looks after the household chores and in her absence, the father does them. Father is having role burden. The communication pattern between the family and his family between the patient and his family members is switchboard. The patient sister-in-law takes help of her husband to interact with the patient. High noise level are present in the family due to patient's illness. Reinforcement for desired behavior is absent. Involved parenting is present in the family. The patient's father follows permissive parenting style. The family has a need-based relationship with each other and emotional connectedness is absent. Family rituals exist in the form of celebrating festivals and attending social gatherings with paternal family members. Problem-solving abilities and strategies are inadequate in the family. Father and elder brother take the help of neighbors and relatives to solve problems of the family. Primary, secondary, and tertiary support systems are adequate. ECOMAP reveals that the patient has healthy relationship with his father, need-based relationship with his elder brother, and friend relationship with his sister-in-law. On quantitative assessment, it was found that the family is dysfunctional in the areas of roles, communication, behavior, control, problem solving, and generally family functioning as per NADMaster family assessment device. In psychosocial management, strategies like intake, building up therapeutic alliance, activity scheduling for behavioral activation, psychoeducation, and motivational enhancement therapy, that is MET, were followed with the patient. With the family members, psychoeducation, structured family therapy, focusing on communication, reinforcement, boundaries, and express emotion were also followed. Disability welfare assessment and counseling were conducted. Discussion. The parents' role is very important in the upbringing of the child as a psychologically and sociologically adjusted person, as given by Stone and Church in 1968. The patient's mother died when he was 12 years of age. Losing a parent during childhood or adolescence impacts the child or adolescent social and emotional development, which also happened with our index patient. The next patient faced poverty in his household while he was growing up, and similar findings were also found by Stratman et al. In 2019 and Hanson et al. In 2007. Poverty in household with children or adolescents has early mental health status to be a risk factor for later drug misuse, as we have already seen in the present case. The family dynamics reveals that the internal boundary was found to be open and the external boundary was diffused, and the family is following switchboard communication pattern. Gruber and Taylor replicated the same findings that family role structures and role assignments can be barriers to facing substance use and abuse issues. Intake and rapport building was done with the following the principle of meaningful relationship of social casework with positive response to pharmacotherapy like tablet, respirator, naltrexone, and clonazepam. Rapport building was gradually established with the patient. As the patient came with long-term illness of schizophrenia, he was not maintaining his personal hygiene. With unstructured activity scheduling, initially focus was on behavioral activation. Especially personal hygiene. Porter et al. In 2004 and Akers et al. In 2011 showed that the behavioral activation may interrupt the vicious cycles by assisting individuals with schizophrenia to reconnect with positive experiences using daily activity monitoring, values and goals assessments, and goal-led activity scheduling, which was also done with the present case. Psychoeducation session was taken with the patient. The focus was on formation of appropriate self-care behavior. Linden et al. In 2007, Bigstall et al. In 2005, and Magnoli et al. In 2006 pointed out that psychoeducation of the patient and family members is associated with shorter duration of hospitalization, reduced number of relapses, improvement in the state of health and psychosocial functioning of the patient, as well as their better cooperation and extensive knowledge about illness. Motivational enhancement therapy, MET, was taken for controlling substance abuse disorder. Miller R.W. is in 2013 shared that the motivation is essential for person to achieve behavioral change and maintain goal-directed behaviors. Project Match Research Group team, UKTT research team, and Selvan et al. Also find that the MET has been shown to be efficacious in reducing alcohol consumption and related consequences. Indian Disability Evaluation and Assessment Scale was administered to the patient, and he was found to be moderately disabled. The certificate process was initiated, was counseled, and he and his family members was counseled regarding the welfare benefits. In the family assessment, it was found that the family unit is malfunctioning. Family therapy was done to help the family lead a healthy life. The structured approach, as given by Minoshi in 1974, of family therapy postulated a normative family model, claiming that family functioning particularly well when certain family areas prevail. As we have already found that there are a lot of areas where family was malfunctioning. That's why family therapy was done with the present case. Conclusion. Psychosocial intervention work on the premise that individuals are capable of change if they are supported effectively. Cooper et al. In 2020 pointed out that a combination of pharmacological treatment and psychosocial intervention in the first line recommendations for treating psychosis, as this helps with better outcomes and reduces hospital administration rates. The outcome of the psychosocial intervention shows that the patient has reported significant improvement in his illness. His understanding of illness was enhanced. His motivation for change for substance abuse improved from pre-concentration to preparation stage. The outcome of the psychosocial intervention at the family level shows that psychoeducation improved the family's knowledge about the illness. The communication pattern among the family members was improved. Improvement in the expressive emotion was also noticed. These are the references. Thank you.
Okay, so while Paulmi was presenting, our another chairperson also entered let me introduce Dr. Moolraj, faculty from the Department of Social Work from Chaudhary Bansi Lal University, Bhiwani, is also here with us, another chairperson for this session. So this presentation is over, and now over to you, both the chairpersons, Dr. Manjurana and Dr. Moolraj. Hold me, you just stop your presentation, please.
Okay, okay, ठीक है. Any question?
Palomani, you have presented well. You have discussed the psychosocial factors of the substance use psychosis, actually. You have discussed most of the factors you have discussed, like poverty, poor education, and poor parenting. You have discussed so many factors. But for prevention of the next for mental illness, so you should take care of the environment of the patient, peer group of the patient. You have to manage all those things to prevent the patient for future management.
Yes.
Okay.
Dr. Manju, I have a query if I may be allowed.
Next presenting. Dr. Bhupen, please.
Tell me, what was your measurement for your this case study? See, in your findings, you are telling that several things have been improved. But what is the basis? It is just your feeling, or you have something to quantify that yes, it was at this level and now it is improved at here.
Yes, sir. We have measured it through a McMaster family assessment device. Again, was applied to the patient, and as the day-to-day basis, we have observed that a patient has improved, and his ratings in the YMRS scale also improved. That's why we came to realize.
But I think you forgot to present here in your presentation that whatever ratings you found. So in your presentation, it reflects like you started working with your patient. So you observed before, and then after your intervention, you observed him again, and then you concluded that it's improved. You cannot call it research if it is just either you have to comment it that it is your observational research, and even in your observational research, you make certain criteria to comment on it. So you have to work on your research part. When you are talking something, you are claiming something, it is a research, and that result must be reflected, right? So that part is not reflected in your presentation. And I think for this same research, you was thinking that it is being rejected from the review committee to be presented. That was the ground, I think, where they found that it is not meeting the criteria for considered in the award category. Anyway, but it was a good presentation. You must have made some other certain guidelines to making it like a more scientific one. Thank you, Dr. Manju and Dr. Moolraj. Please proceed.
Thank you, Dr. Ben.
So if both the chairpersons allow, I can call the another presentee. It is Rickson Agmeno.
Yes, sir.
Rickson, can you help me to pronunciate your name properly, please?
Sir, it's Rickson Angmo.
Rickson Angmo.
Angmo, yes, sir.
Okay, thank you.
Hope my screen is visible, sir.
Yes, the screen is visible.
Yes.
I hope that you would mind the time limit of 8 minutes.
Yes, sir. I'll limit to the time. Okay. So good afternoon, everyone. Ma'am, can I start?
Okay, proceed the thing.
Yeah, good afternoon, everyone. So my name is Rixin, and I am doing my PhD currently at the Department of Psychiatric Social Work, NIMANS. So I'm going to present a review of literature which is on self-harm among women during the perinatal period. So introduction, self-harm is the act of deliberately inflicting pain and damage to one's own body, and a perinatal period which constitutes both antepartum and postpartum up to 2 years. And according to the World Health Organization in 2017, about 295,000 women died during and following pregnancy and childbirth. So most of the deaths occurred in low resource settings, and many of the deaths could have been prevented. So self-harm during the perinatal period often precedes maternal suicide, and suicide is one of the 4 leading causes of maternal death. So methodology, the current paper is the conceptualization of self-harm among women during the perinatal period, and to have a better clarity on the concept. So information is being collected from the various articles on self-harm among women during the perinatal period, and which were published in various electronic databases. The concept has been summarized into domains such as prevalence, risk factors, methods of suicide, and preventive measures. So if we look into the prevalence, so according to a study conducted by Campaign, so it says that at least 2 new mothers out of 1,000 suffers from postpartum depression accompanied by suicidal tendencies, and 20 to 30% of them will actually attempt suicide. So rate of thoughts of self-harm during pregnancy and the postpartum period ranges from 5 to 15%, with higher rates being found in the vulnerable population. And another study which was done by Pop et al., which shows that women during the first year postpartum, so rate of thoughts of self-harm was 16.79%. And another study which was done by Weissner, so it shows that out of like from 10,000 women, 3.2 actually had the thoughts of self-harm. And this is 1 out of 6 perinatal women had thoughts of self-harm according to this Gather studies, and 1 in 10 women reported experiencing thoughts of self-harm during the postpartum period. So another systematic review which was conducted, in which they shows like self-harm during pregnancy ranges from 0 to 2.39%, self-harm during postpartum period ranges from 0 to 2.41%, and self-harm during pregnancy with women who are having severe mental illness or serious mental illness, it shows 0 to 23.78%, and women who had in the postpartum period with SMI, its range is still to 21.9. So it's during the pregnancy is the highest which the study shows. So most of these studies all are conducted in the Western countries. I could not find any Indian studies which conducted or assist on the self-harm during the perinatal period in India. And whereas risk factors which they have mentioned according to the different studies are history, the women who has a history of self-harm, those who are of younger age, those who have a history, or those who are currently using substances, or those who have undergone domestic or sexual violences, genetic risk, or the severity of the illness. And these are some risk factors which are very specific to the perinatal period. So psychiatric disorder, substance use disorder, dual diagnosis, or women who has a hospitalization more than once. So those who are, they are at higher risk. And again, this study also shows younger age. And many studies shows that those who have depression during the perinatal period are a very high risk factor. Then higher risk among women with first onset postpartum mental disorder. Again, women who has the first onset of mental illness during the postpartum periods are also at high risk. And again, as I said, like postpartum depression and symptoms of GAD are more likely to report self-harm during the postpartum period. And self-harm risk peaks at 6 to 12 months. So especially among young women and women with a pregnancy loss or termination, those who have undergone these issues. The risks are more. And being unmarried, obstetric and neonatal complications, history of self-harm, and fetal or infant loss. So these are major risk factors among the women with during the perinatal period. And these are some of the risk factors which Taylor had found out. These are among women during their index pregnancy, that is the first pregnancy. Again, it shows similar findings like younger age, history of abuse or domestic violence. So this is one thing which other study did not report, is like current domestic violence, like domestic violence during the pregnancy. So this is one more findings. Then other like history of self-harm in the 2 years preceding pregnancy, substance misuse, smoking, and acute admission in the 2 years preceding pregnancy, and or stopping or switching the medications which the patient would be on some maintenance medicines. So if they stop or switch the medicine also, they are at higher risk. So the methods of self-harm used by women were mainly overdose, hitting or cutting, or using violent methods such as jumping from height or burning or hanging. So majority of the self-harm event took place at home. So way forward, it's universal screening for self-harm and suicidality during the perinatal period. So many of the women would visit the OBGYN for their ANC checkup. So it is very crucial that if they could screen them for any self-harm or suicidality during that period. And women with mental illness are at high risk, higher risk population, and require close monitoring during the perinatal period. So if a woman is having a mental illness already, and there are chances that they have this suicidal or self-harm ideas during the perinatal period. And if we get to know that if someone or mental health professional or any of the professions are getting to know about these issues, then to facilitate timely and early intervention is very important to prevent the self-harm and not to lead it to a suicide. So conclusion, self-harm is one of the leading risk factor for later suicide, and women with most severe form of mental disorder following childbirth are at significantly increased the risk of dying by suicide. So it is very important that we should pay attention to women who are doing self-harm and which should not lead to a completed suicide. These are my references, and thank you.
Hello.
Yes, ma'am.
Dr. Manju, we are not able to hear from you.
Hello. Hello.
Yes, yes. Now you are audible.
Completed. Hello. Dixon has completed his presentation. Now it is open for any queries, questions, comments. Hello. Hello.
Yes, Dr. Manju, you are audible. I think no one have any query.
Okay,
So
okay.
if you have anything to comment, or Dr. Mugul Raj have anything to comment?
Dixon, you have presented well, but you are mentioning the factors of postpartum period rather than prenatal period.
Ma'am, it's not prenatal.
Please check your slides. You have mentioned the factors in postnatal period.
Ma'am, it's perinatal period, which includes both prenatal and postnatal.
Postnatal period. Okay. You are focusing only postnatal period factors.
No, even during pregnancy, that is the perinatal period includes both pregnancy and postpartum. So it's
Yes, yes.
yes, ma'am.
Okay. The females who are having only mental illness, who are under the risk of suicide?
They are mostly they have the higher risk, those who have depression mainly and past history of self-harm. Otherwise, other women are also at risk, those who are of younger age or they have any violence in their family.
Dr. Moonraj, directly you can create. Yes, yes, please use mic.
Hello. Hello. Sorry for interruption. Hello.
Yes, Dr. Manju, please.
Anji. Dr. Pindi, if you have any query or comments, please.
No, no, no. I don't have. Dr. Moolraj have mentioned something in chat box. I can
Yes.
read that he is asking that how many. You have not mentioned about how many research articles you reviewed.
Okay. Then you can invite. Then I can invite the next presentee.
Okay, please.
Okay. Thank you.
So next is Chanchal Kuswaha. Chanchal, please go ahead.
Hello, sir. Hello, sir.
Yes, Chanchal, go ahead.
Sir.
Yes, your slides are visible.
Okay, sir. So my topic is challenges faced by the person with the mental illness in rehabilitation. रिहेबिलिटेशन में जो भी समस्याएं आती हैं मेंटल इलनेस के दौरान के तो उससे संबंधित मैंने इस स्लाइड में कंक्लूड किया है जिसमें content to be covered: mental health and mental illness, rehabilitation, model of rehabilitation, types of rehabilitation, and challenges faced with mental illness in rehabilitation. At last, conclusion. Mental health and mental illness, according to the WHO 2014, mental health is defined as a state of well-being in which an individual realize their own potential, can cope up with the normal stress of life, can work productively and fruitfully, and is able to make a contribution to their community. मेंटल हेल्थ जो है वो इस बात पे फोकस करता है कि मतलब जो मेंटल डिसऑर्डर है उसका अब्सेंस ना होने के बावजूद उसमें इंक्लूड होता है कि हम कैसे हम प्रतिदिन के काम को हम कैसे हम कर पाते हैं। अच्छा मेंटल हेल्थ तभी होता है जब हम अपने थॉट्स, एक्शन और फीलिंग को अच्छे से मतलब फंक्शनिंग अच्छे से कर पाए। मेंटल इलनेस जो है कॉमन टू टाइप्स के इंक्लूड किए हैं जिसमें कॉमन एंड सीवियर टाइप मेन है। कॉमन टाइप में डिप्रेशन और फोबिया है और ईटीसी, एंड सीवियर टाइप में सिजोफ्रेनिया, बाइपोलर और भी ईटीसी। Rehabilitation. Rehabilitation is a process of enabling the individual to return to his highest possible level of functioning. According to Maxwell Jones, 1952, rehabilitation is an attempt to provide the best possible community role which will enable the patient to achieve the maximum range of activity, interest, and of which he is capable. रिहेबिलिटेशन में हम किसी भी मतलब पेशेंट का हम फिजिकल, साइकोलॉजिकल और सोशल एंड वोकेशनल हम रिहेबिलिटेशन करने की कोशिश करते हैं जिसमें हम साइकेट्रिक रिहेबिलिटेशन के अंतर्गत हम लोग उसका उपचारात्मक अप्रोच पे हम फोकस करते हैं, जिसमें हम उसको सपोर्ट, इन्वायरमेंटल सपोर्ट और लर्निंग सपोर्ट भी हम उसको प्रोवाइड करते हैं। Models of rehabilitation. There are models of rehabilitation team, multidisciplinary, interdisciplinary, and transdisciplinary. Rehabilitation models encompasses a variety of approach designed to help individual recover and regain functionality in various aspects of their lives after experiencing illness, injury, or other challenges. There are some common rehabilitation models, जैसे biosocial psychosocial model, personal center and client center model, medical model, social model, strength-based model, psychoeducational model, community-based rehabilitation, recovery model, evidence-based model, evidence-based practice, interdisciplinary and और multidisciplinary approach. इस पहले बायोसोशल मॉडल में हम व्यक्ति के फिजिकल और साइकोलॉजिकल और सोशल एस्पेक्ट पे काम करते हैं, सोशल एस्पेक्ट पे काम करते हैं, जिसमें हम पर्सन के उसको रिहेबिलिटेट करते हैं उसके इन्वायरमेंट में। पर्सन सेंटर एंड क्लाइंट सेंटर मॉडल में हम इस बात पे फोकस करते हैं कि इंडिविजुअल का जो गोल है, प्रेफरेंस है और वैल्यूज है, उस पे हम उसका प्लान बनाते हैं और उसको उस पेशेंट को हम मैक्सिमम स्पेसिफिक नीड हम प्रोवाइड कराते हैं। मेडिकल मॉडल्स में हम पेशेंट को रिस्टोर करते हैं फिजिकल और मेंटल फंक्शन के लिए और उसको ट्रीटमेंट प्रोवाइड करते हैं। जबकि सोशल मॉडल में हम व्यक्ति के सोशल बैकग्राउंड पे काम करते हैं, जिसमें सोशल बैरियर और प्रमोटिंग सोशल इंक्लूजन पे हम वर्क करते हैं। स्ट्रेंथ बेस्ड मॉडल पे हम व्यक्ति के स्ट्रेंथ को बढ़ाते हैं, जिसमें हम उसको उसकी डिफिसिट और लिमिटेशन को हटाकर उसकी एबिलिटी को स्ट्रेंथन करते हैं। साइको एजुकेशनल मॉडल में हम व्यक्ति को, क्लाइंट को मैनेजमेंट एंड कॉपिंग स्ट्रेटेजीज सिखाते हैं, जिसमें हम व्यक्ति को इन्हांस करते हैं उसकी देयर एबिलिटी एंड सेल्फ मैनेजमेंट, देयर हेल्थ एंड वेलबींग के लिए। कम्युनिटी बेस्ड रिहेबिलिटेशन में हम
Chanchal, you have 2 minutes left out of your 8.
कम्युनिटी में रिहेबिलिटेट।
Chanchal, sorry to interrupt. You have 2 minutes left out of your 8 minutes.
Okay, sir. Each rehabilitation model may apply in various settings such as hospital, outpatient clinic, community center, residential facilities, etc. Types of rehabilitation: mental illness. In mental illness, cognitive rehabilitation, rehabilitation, physical therapy, recreation therapy, speech and language therapy, occupational therapy, vocational rehabilitation, respiratory therapy, जिसमें हम कॉग्निटिव पे काम रिहेबिलिटेशन करते हैं, मेमोरी, प्लानिंग, डिसीजन पे काम कर रहे हैं, उसको दवाइयों, ड्रग्स यूज के थ्रू हम उसको रिहेबिलिटेशन में करते हैं। फिजिकली एक्टिविटी और एक्सरसाइज में मतलब उसको इन्वॉल्व करके हम उसके बॉडी मूवमेंट को ग्रोथ करते हैं। रिक्रिएशनल में हम उसको म्यूजिक और आर्ट थेरेपी के द्वारा उसको इनहेंस करते हैं। स्पीच एंड लैंग्वेज थेरेपी में हम उसके वॉइस, लैंग्वेज एंड टॉकिंग डिफिकल्टीज पे वर्क करते हैं। ऑक्यूपेशनल में उसको मोटर स्किल और बिल्डिंग कर इनहेंस करते हैं। और वोकेशनल में हम उसके इंजरी और इलनेस और मेडिकल इवेंट के द्वारा हम ऐसा वर्क करते हैं कि उसके वर्क वो फिर से कर पाए। रिस्पायरेटरी थेरेपी में उसके हम ट्रीटमेंट और मैनेजमेंट पे काम करते हैं, जिसमें हम उसके लंग्स डिसऑर्डर पे को ट्रीट करते हैं। चैलेंजेस फेस्ड विथ मेंटल इलनेस इन रिहेबिलिटेशन। जो रिहेबिलिटेशन में चैलेंजेस आते हैं उसमें यहाँ पहला टॉपिक है स्टिग्मा एंड कल्चर बिलीव। उसको व्यक्ति को यह इस बात का डर होता है कि वह कैसे इस बात को लोगों को बताएं और सोशली एक्सेप्टेबल नहीं हो पाता है। लिमिटेड एक्सेसिबल टू मेंटल हेल्थ एंड सर्विस उस मेंटल हेल्थ सर्विस जो है बहुत ही लिमिटेड है इंडिया में। इंटीग्रेटेड ऑफ मेंटल हेल्थ इनटू हेल्थ केयर सिस्टम, लैक ऑफ अवेयरनेस एंड एजुकेशन, व्यक्ति को अवेयरनेस नहीं है, एजुकेशन नहीं है इस मेंटल इलनेस के बारे में, और साथ ही साथ हमारे सोसाइटी में भी इस बात अवेयरनेस का बहुत ही लैक है। कल्चरल कॉम्पिटेंसी, क्वालिटी ऑफ केयर, किस तरह का हम क्वालिटी दे रहे हैं केयर का, जैसे प्राइमरी केयर गिवर होते हैं जो कि मतलब काफी वो भी इस चैलेंजेस में वो चैलेंजेस फेस करते हैं कि हम कैसे हम मेंटल पेशेंट को हम कैसे मतलब केयर दें। पॉलिसी एंड रिसोर्स एलोकेशन, फैमिली एंड सोशल सपोर्ट, डुअल डायग्नोसिस के तहत हम ये देखते हैं कि व्यक्ति को अल्कोहल एडिक्शन भी है, साथ ही मतलब उसके साइकोलॉजिकल प्रॉब्लम भी होते हैं, जिसमें एक से ज्यादा बीमारियों से वो जूझ रहा होता है। तो ऐसी कंडीशन में हम कैसे रिहेबिलिटेट करें, इस चीज का प्रॉब्लम आता है। ट्रीटमेंट कंप्लायंस, complex needs, relapse risks, limited resource, family dynamics, reintegration, crisis management, economic constant, social isolation, social support। व्यक्ति जो होता है बीमार, जो मेंटल इलनेस से बीमार होता है, वो समाज से एकदम अकेला हो जाता है, वो अकेले में रहना प्रीफर करता है, और सोशल इकोनॉमिक कॉन्स्टेंट में उसको इकोनॉमिकली प्रॉब्लम आता है। जो फैमिली का जो हेड ऑफ फैमिली मेंबर होते हैं, जिसपे इकोनॉमिकली प्रेशर आ जाता है कि हमें मेंटल भी उसकी ट्रीटमेंट में भी पैसा देना और घर भी चलाना है, जिससे अगर वो केयर गिवर अगर वही मेंटल पेशेंट हो जाता है तो और ज्यादा इकोनॉमिकली क्राइसिस आ जाती है उस फैमिली में, जो कि काफी मैनेजमेंट करने की जरूरत है। इसीलिए रिहेबिलिटेशन बहुत ही ज्यादा इम्पोर्टेंट है। कंक्लूजन, these challenges required a holistic approach that considered both the physical and mental health needs of individual undergoing rehabilitation. This approach should prioritize empathy, education, and comprehensive treatment planning to support long-term recovery. A multi-pronged approach involving advocacy for mental health awareness, policy reform to enhance service delivery, capacity building for mental health professionals, and community engagement to reduce stigma. Efforts are underway in India to expand mental health service and integrate them more fully into the healthcare system, but a continued investment and advocacy are essential to improve outcomes for individuals with mental illness in rehabilitation. Thank you, sir. Thank you, sir.
Dr. Manju, you are mute. Yes, Dr. Manju, please.
Okay, finally. Actually, mic was not working. So, Chanchal, you kindly you have to work more on it, and the challenges which you have shown, with the challenges faced by mental illness, this part of your presentation, actually you kindly improve, make it more better, and you kindly align it with the finding of the researcher or mental health practitioner, so that this topic can be made better. And it seems like you are presenting a particular concept. You have not followed proper structure of writing a research paper, like methodology and result and discussion part, right? So that's all I want to share. Yes,
sir. Thank you, sir.
Hello.
This time I will conclude.
Dr. Manju, yes, please.
Hanji. Chanchal, you have presented only theoretical part of the rehabilitation actually. If you could have included any case vignette and all, then it could be like more useful in day-to-day practice in mental health field actually. Because in mental health field, there is a very difficult task to rehabilitate the mentally ill patient and to reintegrate in the society. It's a very difficult to in India because there are very few services are available in India. So if you like present in a practical approach, then it could be very useful. Thank
you. Okay, ma'am.
Now, Dr. Bhupen?
Yes, doctor.
You can, if you want to comment any.
No. Nothing from my side.
Then please invite the next presentee.
Okay. So next we have Alicia. Alicia, are you with us? If you are in the attendees list, please raise your hand so that I can bring you in. Alicia, Ishita, and Nishtha. Okay. It seems none of them are here. Final call from my side. If we have Alicia Dahel, Ishita Singh, and Nishtha Bist, please raise your hand so that I can bring you in for your presentation. Dr. Manju and Dr. Mulraj, they are not there, so you can conclude, please.
Yes, sir, they are not in participant list as I am seeing. So, yeah, Dr. Manju, you may please start.
Hello?
Yeah, you.
There are no panelists are there? No other presentees are there, Dr. Bhupen?
It's over, Dr. Only 3 were there and they presented, 3 are not.
Okay,
3 are
okay,
absent.
okay. Thank you so much.
Okay, so if both of you would like to comment anything to all of them or to any of them.
Okay. Thank you, Dr. Bhupendra. It's an honor to be part of this 42nd conference of ISPSW. I am really grateful to the organizing committee, especially ISPSW President Professor Kanagraj and Secretary Dr. Bhupendra and all other committee members for providing me this opportunity to contribute for the conference. And there was only, fortunately or unfortunately, there was only 3 presentations in the session, and it is, I think, a short session, but the discussion which was held in the session, I think it will be very, very useful for the, for the improvement of improvement in the area of mental health. And I think these participants, especially Chanchal and who was the second? Alicia? No. Yeah, Alicia.
Yes, Rigzan.
Rigzan.
Second was Rigzan and Chanchal.
Only 2 was there?
No,
right?
3. First was Paulmi.
Okay. So, researchers, they need to work more on their area, and I was, when I was listening to Rigzan Angmo, although it was good presentation, but she can all other co-author with her, they can work more on their research article by applying some latest tools or technique, like with the help of bibliometric tools, that this article may be it can be improved, and it will be good to publish in a good reputed journal. And similarly, Chanchal need to work more on her article. So I'm grateful to other chairperson, to the person of this session, Dr. Rana, for being here with us and for sharing her insightful experience and knowledge with us. So I'm once again grateful to all the presenter, organizing committee, and the chairperson of this session. So thank you.
Thank you, sir.
Dr. Manju, any final comments from you before I say to happy birthday to you?
Raghupen?
Yes, I was asking that any final comments from your side before
No,
I
no,
say
no.
happy
There's no
birthday to
final
you.
comment. Now I am going for punching in the department.
Okay.
Heavy rain is there.
Okay. Thank you, both the chairpersons, Dr.
Okay.
Muldas,
Thank you,
for
Dr. Pen.
Thank you, sir.
sharing
Thank
your
you.
valuable time, and Dr. Manju Rana for spoiling her birthday, and the cake remain waiting for her. It's her birthday today. So we all
Okay.
are wishing you happy birthday, Dr. Manju Rana.
Thank you, sir.
Thank you all. And now we are about to end this session. And we would start from another link that is given on all the schedules. By mistake, in few previous schedules, that password being mentioned wrongly. So that last two digits are just consider it as correction. That password is 28062024. The date of conference day 1. 2806 is 28 June, and then the year 2024. So please correct in case you have wrong details for joining the next session. Next session, we are going to have our award paper session by the professional social workers practitioner category. So you all are requested to join our next session, which will be going to held in the same platform with another link. Thank you so much for being with us. Thank you. Thank you, Mulraj sir and Dr. Manju Rana again.
Thank you, Dr. Pen.